Ladies and gentlemen, I'm going to call this meeting to order. I have 10:30 a.m. Please be advised, Richland County Community and Health Services Standing Committee. We are convening today, Thursday, June 4th, 2026 at 10:30 a.m. And we have a 13-point agenda. Miranda, would you please take roll call?
Miller. Here. Kramer.
Here.
Engel.
Here.
Welty.
Here.
Harry.
Here.
Collins Johnsrud. Here. Barris. Braithwaite.
Here.
Chicker.
Here.
You have 8 for a quorum, Mayor.
Okay, thank you. And I would understand that we are in compliance with the open meetings law.
We are properly noticed.
All right, the agenda, we have, like I said, 13-point agenda, so I need a motion to approve.
So moved.
I'll second.
Thank you. Moving on to the minutes from the main, I'm sorry.
You guys have to vote.
Oh, I'm sorry. All in favor, please say aye.
Aye.
All opposed, please say nay. Agenda is approved. Has everybody seen the minutes from our last month's meeting? Are there any questions or changes you want to make to those minutes? Hearing none, I will declare the minutes approved as written. Okay, number 6 is the introduction and review, the purpose of the public hearing we're going to have today.
Sure. I'll jump in here. I don't really have a script for this, so I'm kind of winging it. But Health and Human Services, we're required to every year have a public hearing prior to us creating the next year's budget. The reason for the hearing is so we can obtain community input. Of course, it's for transparency, right? It's letting everybody know how we're laid out and how taxpayer dollars are potentially going to be used for our budget. And it also helps us with our future planning. So that's kind of the purpose of this hearing. It did run in the newspaper for 2 weeks. So it was on the website so that the community was well aware of this, and it's just an opportunity for them to come and give us input for the future budget.
Thank you. Number 7, we're now into the public hearing. 2027 Health and Human Services budget and citizen comments related to the 2027 Health and Human Services programs and their services. Anybody have any comment on that? Or any questions?
I guess I have one, and that is, it's kind of related to, I know that we receive the expenditure reports, et cetera, but sometimes it's difficult to tell which departments that report here, such as Pine Valley Manor, not only what their budget was, but I know Pine Valley is a revenue producing department. Is that also separately reported so that we can get some sense of?
Starting today. You will have a finance report from Pine Valley.
Yep, it's in the
Yeah,
packet.
It's in the packet.
Yes,
Thank
ma'am.
you. Yeah.
And we'll go over all that. Yep.
It was hard to tell which one it was.
Okay.
I guess I went through all of the attachments.
It's just
I
like
thought
this, it
very
doesn't
much.
include the budget, unfortunately, just because we transitioned over midway, because it was already kind of discussed through our other revenues at the beginning of the year. So that has not been reported, but it just kind of goes over the expenses like HHS does.
Okay, thank you.
Any other comments or questions?
Anything for Health and Human Services? Any questions or thoughts?
I had a concern. I noticed that we're in the hole, as far as where we're at.
Sure, so when we get to 9C, I can speak to that.
Okay, is there any accountability or are we getting reports on how certain agencies are doing that we contract with? as far as, you know, driftless therapy. I noticed they had a huge contract, over $1 million with Health and Human Services. That is a huge chunk of money. And I'm just wondering what accountability there is with how they're providing services, how that is being reported to you, to us. I mean, I know nothing of that agency other than looking it up yesterday, reading about what they do, but how much are we utilizing it? Is it effective for that type?
And how is their effectiveness measured?
Yes.
Madam Chair,
Yes.
just a reminder, this is a public hearing portion.
Mhm.
And also a reminder that if, when you're done, you have to compose it correctly.
Okay, so we do need to adjourn.
That we know not adjourn.
Close the public.
We close the public hearing.
Okay.
So for the 2027 public hearing portion, for
Here has 3 times.
so is this a question about our 2027 budget, or is this something that you want clarification on when I get to contract monitoring? Sorry, I know it kind of overlaps, but.
Well, I see that we're already, you know, in that budget cycle with, we've already paid a certain amount of. So I guess my question is, what kind of review are we doing on the services? I mean, is there any type of, what's this contract look like? How do we evaluate how well they're doing? Is it a good? I mean, it's a lot of money.
And if this is part of the public hearing, what would be the plan?
For that,
The
for 2027,
Yes.
for doing that monitoring.
I'd like to see a report as to what they're doing, who they're serving. What kind of activities are they doing? If they're working with the youth, what are they doing?
So so Driftless is one of our comprehensive community services providers. So they are contracted and 100% paid for out of the CCS program. So it's all Medicaid paid. So no tax levy in that particular contract. As far as what they're doing, they're providing services through that program. And we can get into more detail on what exactly CCS does as far as providing services to individuals in the community. That's kind of a high level. We can.
Still affecting the budget, correct? It's still affecting our budget as on a whole. Other programs.
It affects the budget in that we have to budget for it, but it doesn't impact the tax levy.
Okay.
Yes.
Thank you.
Yeah, yep.
I have a comment and then a question regarding programs. So when I was reading through the packet today, I noticed that there are many, many, many programs that are offered and supported through Health and Human Services. Is there overlap in some of the programs? How are they organized with oversight so that it's streamlined? It seemed like it could be overwhelming to manage that many individual programs. And maybe it isn't, but I'd like to know how you do that, how you manage that many programs with the awesome limited staff that you have.
How do I do it?
Or how does the team do that? Because
I have those individuals over there, yes.
but is there overlap between the programs or are they all individual siloed programs?
The programs are individual programs, yes, but sometimes the clients we serve do overlap. And so then the managers work together with those individuals to make sure that services from this area are being provided as well as this area.
And then do you count that client twice or do you count that client once?
We probably,
Yeah,
sorry, Roxanne wants to jump in.
Yeah.
Yeah.
So like the ADRC, we have to report all of our clients to the state. We have a state database. So any interactions that we have with individuals for our programs that are funded through aging dollars, which is Older Americans Act funding, or ADRC dollars, which is state funding, is a grant through the state. Those are all contained within the ADRC, and we have to report who we've seen. So if we also maybe are working with somebody that's APS, which is under our behavioral health unit, or CCS, which is also in behavioral health, they have to count that for their programming. So we're responsible to our different states to ensure that we are reporting information based on the services provided.
And is that accounting effort done within each individual program, or is there one person who helps with, does all that?
No,
So you
it's,
each are very,
right. So we're kind of siloed off. We're part of the agency as a whole. But our programs are siloed off because of the way they're funded. So because they're funded, behavioral health has their specific funding, public health has theirs, children's and economic support as well. And then we have our separate funding streams. So they are siloed off, but we all work collaboratively to ensure that the individual gets to where they need to go.
yeah, does that help? It's probably a wonderful thing that you're in the same location and that you work near each other, which would help with it. It just seems really cumbersome to manage that many programs and to account for everything that needs to be done.
I think when we get to the annual report, you kind of see how it all pulls together.
We just had an example of that yesterday at the ARDC meeting. We had the Adult Protective Service presentation, and the mental health was present. And when they go in to investigate, when public health gets involved, when the sheriff gets involved, I mean, it was amazing the coordination they were doing. It was really impressive.
Any other comment? Are there any other comments or questions? Any other comments for the public hearing? Okay, good. All right, the public hearing is hereby closed, and we're going to move on to public comment, number 8. Anybody have anything? If not, we're going to go on to our reports. The first one is HHS Director, your administrative report, please.
Sorry, taking some more notes. Sure. So this is a monthly report. This kind of gives you an update on the last, since the last time we met, on some of the work that we're doing in the moment. I think the ADRC, I wanted to highlight, seniors farmer market voucher season is upon us. So if you're 60 or older and you could get a hold of the nutrition program, the ADRC, and see if you're eligible to get a $25 voucher to go to our farmers market, which is kind of a neat little benefit. That's kind of a highlight there. Men's Shed continues to go to that. Roxanne's reporting that that's been going well and has had good turnout. Child and Youth Services, we filled a social work position. They started Monday, so that was exciting. We do have one vacancy still to fill in that unit. Social worker, we're looking for another social worker. Wanted to highlight that there's currently we don't have any foster homes in Richland County, but Brittany has her Ron Fredette, who's our family preservation worker, has taken on that task of doing some recruiting, and she has a couple of potential applicants waiting to be licensed. So which is good news for Richland County to have that resource right local. Adult protective behavioral health. We have a new adult protective services worker started. I believe she did a presentation yesterday already, so she's jumped right in and is doing that work. Tammy Olson is excited to have her on board, I know. And we also, we unfortunately though, we gain one, we lose one. One of our coordinated services professionals has moved on. She moved on to another county. Excited to know that she's still going to be doing the work that she was doing here in the Children Long-Term Support Program, but we're going to miss her, so we're recruiting for that. They just behavioral health unit, the mental health crisis, those kinds of things. always keep them busy, keep them hopping. Economic support, scroll through there, I noticed that, they've met their, goals for answering a percentage of phone calls, so they increased their goal. Set a new goal, so that was exciting to see, that they really are passionate about, answering those calls and helping people. As a highlight, I think I mentioned last time, the state approved additional funding for the economic support income maintenance program. Because there's, a focus that's gonna be on quality control. There's gonna have to be some extra work that's done, to make sure that we stay below federal air rate that's set by the federal government, because the impact could be, we'd have to pay back. There'd be fines, I guess, associated with, these higher, air rates. So the state, came up, found some funding, and are going to provide enough money, for the consortiums to hire lead workers, to do this additional quality control work. So we'll be bringing a proposal later to add to hopefully add a lead using that funding, to do that quality control work. But that's coming down the road. That didn't have that ready for today. Still waiting on some information as far as making sure the funding is going to be there. It was approved, but until we see the contract in hand, we're a little gun shy on moving forward yet at this point. And then for public health, I think you probably saw in the news hantavirus outbreak. Richland County so far, we're good. No cases in Wisconsin. Kind of a highlight there. Animal bites, they're having a busy spring. I think I was talking with Brandy last week, and just last week it was just a busy week. That time of year. Let's see, we were lucky enough to have Evan Ewing, public health specialist, do a Make It Okay presentation at our all agency meeting about the stigma associated with mental health, and that was well received, and it was exciting to have that. Tick removal kits have been distributed, so we should be seeing things out there about tick prevention. And I think that's it for all the different units. I think the only thing that's not on here, that I didn't put on here, and is actually since this, and you can see Kelly Levy is not here with us today. Tomorrow is her last day. Tomorrow's her last day. So she's got a few things that she's trying to wrap up before she's out of here. So I'll be her today. So that's a big change for us.
Any questions or comments? All right. B, HHS expenditures report.
Take a little sip here.
Over $2,000, but less than 10.
So I kind of did a quick pass through of our expenditures. The first section is our transportation drivers. They're reimbursed for their mileage every month. With gas prices, it's getting a little harder and harder. Volunteers getting these volunteers to take a trip, but we're looking at ways to maybe incentivize that, gift cards, things like that. So, but otherwise, that's a normal thing that we pay out every month for that. If you looked at our other expenses, you can scroll down. There we go. Kind of wanted to highlight, you'll see Quick Trip on there. We do have an agency vehicle, so we use Quick Trip so if you see that, it's not like we're going out there crazy at Quick Trip, but that's how we fill our agency vehicle. We found that it's saving us a lot on mileage reimbursement for individuals that have in the past used to use their personal vehicle. So you'll also see right under that, Richland County Highway Department, $691.33. Having an old vehicle like we got, it cost us nothing. It was a donation from the sheriff's department, but we do have to keep it up, keep it maintained, things like that. So there's a little bit of that. AT&T Mobility, Staff have cell phones, some staff, not all staff, some staff have cell phones and that's paid for out of their programs. So if you're wondering what's up with all of those charges. You'll see a few charges on here for CCOP. CCOP is our Children's Community Options Program. And there's individuals that are enrolled in CLTS are eligible for reimbursement of certain things through the CCOP program. So these are reimbursements, and this is just pass through. We have funding that we get reimbursed for these expenses. Language line down a little bit. Language line, we're required to provide interpretation services. So language line is what we use for our phone calls. And it's especially useful for our call center. Since we have so many staff that use the call center, that work in a call center, it's a requirement of that. If we continue on, just trying to think outside of normal stuff like utilities, those kinds of things. It looks, we had to purchase some security badges. We split that with Pine Valley. That cost Pine Valley, so these security badges, it's extended our work. Let's see. I think if we scroll down into the aging unit fund, not really a lot there. That's out of the, nothing really there that's out of the ordinary. Center Lane, $640. That was for the volunteer appreciation banquet that we do every year. We host every year.
See a $7,800 charge for catering. What if that would have that been?
That is for our meal sites.
Okay.
They do all the catering for our meal sites. So those are that's the charges for that. Meal sites and our home delivery meals. Sorry, they also.
Thank you.
Yeah, you're welcome. I know that's a big number. And then if we go to the credit, the purchasing card reports, I know last month you had asked for additional details, especially when it revolves around Amazon purchases. We tried to add in a little bit of explanation of what those were specifically for. As you can see, it's office supplies, it's specialized clothing, a swing, Pediasure. If it says CLTS, that is 100% reimbursed program as well through Medicaid. So we're just a pass through. Tebra is our EHR, that's our electronic health record. So that's just a monthly fee that we pay every month to have our electronic health record system. And that's how we do all of our billing to all our different insurance companies, things like that. DQA licensing down at the bottom, $1,100, and then the other one is a split. That's every 2 years we have to pay that, and that's to maintain our behavioral clinic licenses. We have to pay that to the state. By the way, a lot of background checks. We have to do background checks on employees, new employees, current employees. They have to have them done every 4 years, every 4 years. And then volunteer drivers. So background checks. Questions about expenditures?
When I went through that, I saw where Simon's was on there. What connection to Simon's do you have?
Simon's, if it's the one I think you're looking at, that would have been for, that would have been through the CCOP program, Children's Community Options Program, and it's passes. So children that are eligible for the CLTS program are eligible for these, are eligible for these passes.
Oh, okay.
Yeah.
All right.
If they so choose, we don't automatically just give them to them, but if that's something that they're interested in.
Are the school districts notified of that so that they can reach out to the parents, or how is that?
Notified about the passes?
Yes.
It would just be for the children, long-term support children that are enrolled in that program. Yep, it's not for the general public, no.
Is there transportation involved too, to transport the children to Simon's? Or is that up to somebody else to get the children there?
Who would train? There would
The
be the
families,
families.
providers. typically these children are children with disabilities, so they should be with a caregiver.
Is that enough detail? Or is there something else you were maybe thinking of, or?
It's probably more detailed than we
Yeah,
need, but it's very helpful.
I know, because you're newer to this committee, so, eventually you'd be like, yeah, Steph, go, move on.
Yeah. I'd rather have too much.
Too much, not enough.
And I appreciate the explanation. Programs are reimbursable. That's very helpful too.
Is that something that could be put on here as far as which are Medicaid reimbursable versus the tax?
I think we've talked about that in the past, and it's just, I think it's a matter of just adding potentially another column or something.
That would be helpful.
Or like, I think in the past, they said levy, no levy.
Yeah.
I think has always been kind of a request, so I can see if we can figure something out for that.
Any other questions? C, 2026 budget summary and Richland County 2026 placement report.
Sure, me again.
You-
All right, so, for the end of April, we should be at about 33% utilization. If we look at the individual units, and starting with administrative services, similar to last month, building and operating costs, are a little bit above that, but, our checkbook basically gets hit with some, pretty large expenses at the beginning of the year when it comes to like workman's comp and all our different liability insurances. So as the year progresses, the goal is to that'll level off and it should stay within below utilization or below the budget. Public health is in a good spot right now. Elderly services, nutrition, not really sure why that's a little bit low, but
So we had budgeted for a new vehicle because our vehicles
that's right.
are very old. So there's an added expense for a vehicle, purchase vehicle this year. So that's why it's so low. But when you take that vehicle money out, we're right on track. We're about 5% below budget right now.
thank you, Braxton. Economic support, they're pretty on course there. Child and youth services, CPS contractual services. Child and youth services is probably a little bit low, but they've had vacancies, as you are aware of. So, if we're fully staffed, sometimes that will bring us a little bit closer to what was budgeted. CPS contractual services, those are our, that would be, kinship care funding, subsidized guardianship funding, that we pay out. And that'll fluctuate based on the number of children, those kinds of things, how much of our legal funds we're tapping into. So fewer kiddos, that'll be lower. So, as you'll learn when we start to do the 2027 budget, we budget based on like a 3-year average. And we kind of try and estimate what we think we're gonna have the next year and kind of go from there. So that could always be a little different.
If there are foster homes that are licensed, where would those costs are there costs associated with that, and which line item would that fall?
That would come out of our placement fund. So did I say foster what comes out of that one is kinship and, right?
And the subsidized guardianship.
Yeah, that comes out of there. All the foster care, that kind of placement money, that'll come out of the placement fund, the child abuse placement fund. It's a little different.
Is that listed on this?
That, it's not on this one, that's the separate placement one, that's the separate placement.
All right,
Yeah.
thanks.
Yeah, no, good question. And then when we get to behavioral health, you can see several programs there. Mental health outpatient crisis services. I wouldn't say that that's too low. AODA outpatient, That one is a little low. We've had some vacancies. We have our recovery services coordinator. That would probably be more to that reasoning. CCS, Comprehensive Community Services Program, $3.3 million budget that you were kind of curious about. Yeah, so that is a pretty big program. And so that does include that 3.3 million, includes all of our contracts with all of our CCS providers, including Driftless that you were talking about. So that's built in there. And that budget is same thing. It's kind of based on our historical averages, how many clients we think we're going to be serving the next year. And we kind of try and build that accordingly based on rates that these providers might charge us and things like that. So so that's where that is. A note on that when it comes to this report, and I can try and figure out how we can reflect that a little better in the future. But that's usually about a month behind. So those expenses are only reflective of, I think, at least 3 months. So not the full 4 months. So it skews it a little bit.
So are these contracts written up on a yearly basis and are they etched in stone as far as, okay, 1.5 million for services, that is what they expect to receive?
And they only receive it if they do the work. So it's not like we just give them $1.5 million. They have to submit, they submit invoices every month and they submit, we call them billing logs, right? They submit billing logs and say, this is the work they did, this is how much time they spent, including like service notes, all those things. We have somebody that reviews all those notes. And so it's a pretty in-depth cross-check. We actually have a compliance officer that really digs in on those things. And for the CCS program, they set authorizations on what these providers can provide for services. And we keep an eye on that, making sure they're meeting those requirements, things like that. So,
Do you ever receive other bidders, other contractors that bid? Has this always been a person that we've used, or?
this is somebody we've used for years, but they're not our only one. Anybody's welcome to apply to be a CCS service provider. Obviously, they have to have the credentials or things like that, but they just happen to have a pretty good base. That we're not the only county they work with either, though. They're in several counties, so.
So it's not like something you put out for public bid or anything?
No, service providers are not put out for bid. They are not. And the procurement policy doesn't require that we do that. So, because we can't, it's also kind of a little bit about client choice too, right? So we can't limit, we try not to limit choices. Things like that. Say things like that.
Steph, would you introduce your staff president?
I can. I was going to do that when we got to annual report. When I got to annual report, I was going to do that, but I can do that now. That's not a problem. Sure, we have Tammy Olson. She's the behavioral health unit manager. Been with us. She's new. She's only been with us since the end of November. So, and then we have Lori Cooey, who's the behavioral health supervisor. Lori's been with the county forever, so I don't know, lots of years. We have Emily Shelton. She's the behavioral health lead. She's been with us about 11 years. Yeah, I remember when she got hired. So then we have Roxanne Kluber-Gerber. She's the ADRC manager, Aging and Disability Resource Manager. We have Brianna Turk, Economic Support Manager. And then we have Brittany Wirtz, Child and Youth Services Manager. And then Brandy Anderson, Public Health Manager. So I told them they all had to be here today in person for the annual report, so.
Thank you.
Thank you.
Yeah, you're welcome. So again, Adult Protective Services, that is where it should be. Treatment court looks good. Birth to 3 program, a little low there, but that could also be, could be, I don't know what that could be. Why it's a little low, but that's okay. That's okay if we have birds of three's a little low. And then the CLTS program, children with long-term support, that's right up there. So overall, as an agency, we're at about 25% utilization. So we're under budget for expenditures. And then you asked about the negative. It's why you asked about the negative. Yes, Mary, you asked about the negative. So this is where it gets a little wonky. We report out what we've actually received for revenue so far, right? So you can see we received 1.2 million is what we actually received. That's what's in our checkbook when I run this report. So then what we try to do then is I try and estimate, guess. So in the meantime, we've done claiming on a different claiming for the various programs, right? We've sent out saying, hey, these were our expenses. Can we have our money back? That usually is about a month behind. It's usually about a month behind, I want to say. So that anticipated revenue is just our best guess based on our claims, based on what things out there for revenue for us to get back in. So that's kind of where that's at. So when I do my best estimate, that's where the core balance is about 9,000 in the hole. But that's not even 1% of a $9.5 million budget, not even. So, and this time of year is still really early. If we start to get to September, October, and we start seeing possibly bigger negatives, then that's where we might have to do a deeper dive and see what's going on. But that's where the fiscal staff work really hard to make sure that money's coming in and going out, coming in. So.
How many individuals receive services through April, and what percent of the population of Richland County is that?
Oh geez, that's through April total. That I might have to do some research and bring that back.
I'm just curious.
Total.
What I'm really looking for is the percent of our population that are receiving services through health services.
I know when we get to the annual report, some of that's in the annual report for some of the programs.
In light of that, it'd be interesting to see it in terms of like a 3-year, 4-year period. See it through.
Broken down each department.
Yeah, a trend line.
We probably pull something together, annual reports. So.
The annual reports are pretty thorough.
Yeah, but if they're looking to see like a trend line, probably, sorry, I'm kind of problem solving. Well, but we can put it on our agenda for our next leadership team to see if we can come up with
Looking for a trend line per department within HHS.
Yeah, to know whether the need is increasing, decreasing, are programs being utilized more or less than prior years?
Yeah, comparative.
Yeah, and where do you see it going in the future?
I'm also curious about Medicaid too, but given what's going on in the politics of today, as far as what are you planning ahead for future cuts? What is that going to look like?
You mean if Medicaid it makes cuts?
The program gets cut back.
And the overall context for it is we heard from presentation county board just a few weeks ago, that we have a 15% poverty rate and 40% higher than most in other counties. So that's why we want to take a look at that material, see just where we sit in light of that.
And a more aged population.
Right. With the single widows being the most vulnerable. That's what we were told. Were the increases.
All right. Got notes.
And
And I'll have a recording to go back.
one comment. I would probably not do trends back 5 years because COVID. COVID really affected us. So I would say maybe 24 would be a more realistic. If you look at 20 to 23, you're gonna be, oh my goodness, that graph is just, yeah, it's gonna be super, super skewed. So
Yeah.
if we do something like that, I would not recommend looking at those COVID years.
Because we would have had a lot of, our numbers would have been higher during those years.
But I'm gonna interrupt, it would have affected public health programming on our numbers quite significantly, so I just.
Right, and I know economic support, it would have affected economic support because more people were eligible for Badger care through,
They stayed eligible during that time. During COVID, they stayed eligible and people were becoming eligible. So it was really a loss.
So if we looked at 3 years, looked at 22,
24, 25, 26.
Yeah,
Probably what there's-
we'd only have a partial year so far,
Yeah,
so.
we're 26.
so that would be only 2 years, that's not it. We'll play around with it and see. I don't know that I'll have it by July's meeting, but I don't wanna overpromise and
as the budget's prepared for future years, I think it would be helpful to have some of that information.
Yeah, and that's, maybe by the time we get to actually to the point where we're presenting our budget, I have my summary ready, which, to present out potentially.
And if you find that it's overly burdensome, use what you have,
Sure.
Use something that you have rather than.
That's where I'll start. I'll see what I got and then we'll go from there.
Okay.
Yeah. So, but in the end, the negative $9,000, I'm not too concerned about it. It could just be, just some billing delays or things like that, right? We're delayed, but with billing coming back, little things like that. So no concerns. If we talk about the placement report, adult placements, if we look at April, that's again 33% utilization, and we're at 51% utilization. I think I brought this up last month. When you have an individual in Winnebago, it costs you $2,166 per day, 100% tax levy. Which is not to say that a lot of work is not being done in the background to try and find a lesser restrictive placement, one that could potentially, we could get reimbursed because they become CCS credentialed to provide some of the services. And so that's always, that stuff's always happening in the background, sometimes with luck, sometimes with no luck. So that work's always happening. So that's kind of where that one is at right now through April. And then child to child placements, that's like basically almost zero. So that's at 2%. So we have no children in institutions, detention. And I think the reports speak of finding permanency for a lot of the kiddos. So with the goal of keeping kids in the home. And working with them in the home, it's not just go and take kids anymore. It's a completely different mindset.
Do you find that increases as school gets let out?
As school gets let out for the summer,
Yeah.
actually it goes the other way.
That's what,
When school's in, then it could potentially increase because there aren't as many eyes on the children in the summer months. So.
Yeah, and our school professionals are our mandated reporters, so we tend to see more stuff coming in from schools.
So.
Steph, you mentioned the $9.5 million budget, right, for all departments. Of that, probably about $1 million, close to $1 million is tax levy.
Yes, it's not broken out on here.
So I guess the question.
Yes, it's right around $1 million.
How is the $1 million distributed between those departments? Do we know?
So the tax levy is administrative services because we're not necessarily tied in 100% to a program to, building and operations. However, with that said, it's not that we're 100% tax levy, right?
But that's where
Because-
the majority of it will go.
That would be quite a bit of it. Public health, unfortunately, is a significant amount of tax levy in that unit. The funding sources for public health are just so small, right? And it's, yeah. Economic support, there's no levy in there right now. We've been able to, oh wait, no, there's an MOE, there is an MOE, so there's about $150,000 in economic support. But that's an MOE. In order for us to get this total 1.1 million, we have to kick in that much, so. Child and youth services, that's the one that's so far not going, but there isn't any. I don't believe.
How much for public health?
I don't have it broken out on this report per se, but when I do the budget for 2027, that does break that all out. The clinic and crisis, there's a little, maybe a little bit, but not a lot. Crisis services, there is kind of an MOE as well in order for us to get the majority of our Medicaid reimbursement. There's a little bit of a kick in on that. The AOD outpatient clinic, we try not to put any levy in there. CCS, no levy in CCS. Adult protective services, levy. There's a significant, I would say quite a bit of levy in there. I think our only funding in that is about, it's not very much. I don't want to say it's not even $20,000. It's not much at all.
So if they were interested in seeing about what was, say, budgeted for 26, they could go back in the files on their and kind of get that.
Right, there should be a summary for
Yeah.
26 out there.
And-
Now, I'm trying to think of this off the top of my head. Birth to 3, there's levy in. Treatment court, there's levy in. Treatment court, there's levy in it, but not. I kind of skipped over Aging and Disability Resource Center, didn't I? Actually, I was like, keep on going.
I mean, really ADRC, our ADRC contract, there's no levy.
No levy.
So that's, we get a grant and then Medicaid, our older benefit special, most of our programs, Older Americans Act have a required match. And counties are required to provide those services. So we generally do the required match. The only program that is above the required match is our nutrition program.
And that's where the tax levy would go, nutrition.
Yeah, and then our required, the federal government requires that we do match for different programs. It's between 10 and 25% depending on those programs. But ADRC core services, there's no tax on these.
Any other questions, comments? Okay. D, HHS contract monitoring report.
So, we're getting used to that 33% number. So we keep an eye on contracts, and if we start thinking we're gonna be going over that, we would do a contract, we would request a contract amendment. These are contracts, a lot of these providers are ones that we contract with every year. We actually bring these to committee and depending on the amount of the contract, we'll bring these to committee in the fall, the October-ish, November-ish, to get ready for the 2027 year. But some of these contracts have no utilization, but we have them in place because you just never know, right? If we do need to place a child somewhere, it's nice to have that contract in place because then it prevents any delays on making that placement and getting that kiddo settled somewhere. Same for some of our behavioral health contracts. Most of our behavioral health contracts are CCS, Comprehensive Community Services Program, CCS. And as you can see, some might not be used but again, choice, right? It's client patient choice and we share these choices and some are used, some aren't. If they're looking like they're over the utilization for that particular month, then we'll work on doing contract amendments. I think for this particular month, there was two later on, Seasons Counseling and Tiffany Olson, and I believe we've already done amendments on those. We were, let's see. We were curious about some of the bigger contracts, right? Other than Driftless, were there any other ones that really jumped out at you? We have Dr. Sainer, Haley Schneider, Cooley Region Psychiatric, Array. Those are all of our psychiatrists and our psychologists and our nurse practitioner in our clinic. So we contract those.
Stephanie, where is this Driftless, where is that located, Dodgeville or?
Viroqua.
It is in Brooklyn?
I thought it was Viroqua. Thank you.
Which Driftless, there's a couple of them.
Did it get on there twice?
There's like the Driftless Area Inc.
Yeah, that's was a home care provider.
Yeah, that Taskberry, yeah, that's different, so. And I want to say, we've been working with Driftless for years. Years. Driftless has been for years. Any questions?
I see on page 5 of that document, looks like that there's at least one that's Seasons Counseling is over in dollar amount of the contract already.
We've done the amendment. What happens is, my executive assistant, when she gets the signed contract back, then she'll update that and it should be reflected next month. I'll watch for that.
Don't they have to follow their contract? I mean, if they know they're gonna go over their contract, wouldn't they be contacting you instead of billing you randomly? Or do they, I mean, it just seems like kind of a strange system.
Well, so yes, when we do a contract at the beginning of the year, we have no idea how much utilization we're gonna have with them. So, but that's why we do the contract monitor report. So when we get that invoice and we're like, oh, hey, wait, we need to amend the contract because we still have service authorizations in place and we don't wanna, we don't wanna negatively impact a client by taking away a service because the contract is not amended. So I know
Well, this is hard to budget for too, because you don't know how many clients are going to need this service.
Or choose that one.
Yeah.
So yes, so as soon as we saw that invoice come in, then that's when we were like, hey, we need to get this amendment going so that we can stay in compliance with the auditors.
Any other comments or questions on the contract monitoring? Okay. Moving on to the organizational structure.
Oh, you guys are ready for a long one today. So org chart, so contract monitoring and org chart, just for your information, we only do quarterly. So only do quarterly because there's not going to be enough of a swing on the contracts to do that every month. So for our overall organizational chart, which actually is kind of a good thing leading into our annual report, so you can kind of see all of the staff that we have in all of the different units and programs. So if we scroll down to the administrative and financial services page.
That's how many employees in total?
Geez, 60, well, my FTE count is 64.5. but that's not counting all the volunteer drivers, all of the nutrition workers, all of those, that doesn't count any of those, so it's 64.5, just straight up FTEs. Now you guys are gonna probably go through and add those numbers up, but. So for the administrative and financial services unit, as I mentioned earlier, Haley Levy gave her notice. Now is her last day, so there is a vacancy there. And then we have you'll see later in the agenda, we have a retirement happening. One of our fiscal specialists is retiring, and tomorrow is also her last day. So we have those positions. Actually, the one vacancy for this fiscal specialist is already filled, and that individual will start right away on Monday, so that's exciting. If we go down to the Aging and Disability Resource Center, Roxanne Kuberdanter, she is fully staffed. She has no vacancies. Well, not in her core staff. She's always looking for more volunteers. So, but otherwise she's full. If we go to the behavioral health unit, that's Tammy's unit. We have a mental health therapist vacancy. That's a long-term vacancy that's been out there for a while. We're always trying to recruit that. We have the recovery services coordinator position is vacant. And then under the coordinated services programs, all the different programs, CCS, children's long-term support work to 3. As we mentioned earlier, we've lost Jenna, and then we have a vacancy, a CCS service facilitator that we're recruiting for as well. I think that's it for vacancies. Okay. If we go to the child and youth services unit, as mentioned earlier, we're looking for one more social worker. We just had April start on Monday. And then if we go down to economic support, Keely Wolf, since this was this handout was created, she will be moving on to bigger and better things. And then one vacancy we have from the retirement a couple of months ago, and then we do have a vacant position. We did not budget for that position. So that's in that unit. And then finally, the public health unit, we lost Evan Ewing, public health specialist. What we're going to try and do first is we're going to try and see if we can get a public health nurse in, fill that position instead of a specialist, and kind of see if we get any takers on that, so that Brandy has some support nurse instead of a specialist. So we'll see what happens there. And that's it for our org chart for the quarter.
Any questions or comments?
Why all the vacancies?
Why all the vacancies? One person, they're from the northern part of the state and they were able to get a job closer to home with me. What are some of the other reasons? Retirement. I had a retirement. We have somebody that got a position with the state of Wisconsin. So, economic support, that was a retirement. Some, just it varies.
Is the wage comparable county to county? I mean, are we?
Well, I'll just say that no, not necessarily no, we're not. We have in the past lost positions to other counties because they pay higher, but not recently. It's been portrayed to me as a reason for leaving. Just different opportunities. Some people, yeah.
Yeah.
I know, yeah, no, we're not, they do the comparables. I'm excited to see what they come back with on their review of the wage scale this year. I'm excited to see, so.
Anything else? Here we go.
And here we go, the fun part. Once
Yes.
again, thanks for sticking around, Brittany, to learn all about.
Yeah.
He's like, how could I come? How could I come late?
Okay, we are moving on to the Richland County Health and Human Services Annual Report 2025.
All right, so I can start. I think I threw in a cover letter here. A lot of my focus was on sorry. A lot of the things that I focused on in my cover letter were just in overall in general. I think each and every of these managers and all of the staff at Health and Human Services do amazing work to support the mission of what we do. And so I couldn't be prouder of that and to be part of the team in that sense. I think overall though, I think one of the biggest changes in 2025 was the director position. Tricia Clements, she took the county administrator position, and then I took on the role of director. So that was, I think, a major highlight of the year. And then a couple of manager changes.
I think with the extra buzz.
I have to talk a little louder? Okay, alrighty, I'll talk a little louder. So yeah, so I think that was, first and foremost, I think the director position was the biggest change. I jumped into that, which then that left the vacancy in the fiscal position. So we got that filled kind of later in the year. Behavioral health changes with management in that unit. Again, I think staff, when you talk about vacancies, I think staffing has always been a highlight of most of the years is keeping things staffed. But I think what we have to, a good takeaway is that even when we have vacancies, the staff that we have on board, like I said, are really committed to the mission. So they really jump in and continue to do the work. So as far as I'm aware, the citizens, the residents of Richland County don't see the impact to that end. So that was my cover letter, just really kind of pointing that out. Nothing, I let the manager speak to any major changes in their units specifically. Our annual report then moves from my letter to just our mission statement overall. We do have a our mission statement's pretty simple, but a lot of bullet points underneath that mission that I think everybody embraces wholeheartedly. Then part of our annual report, we've always included all of the different committees that are associated with our agency. This committee, first and foremost, we have the Aging and Disability Resource Advisory Committee, Nutrition Advisory Committee. We have a CCS Coordination Committee. We belong to the Mississippi Valley Health Services Commission. Dr. Barris is on that. We have our Transportation Coordinating Committee. So a lot of these programs and statutes require we have these committees just for that additional oversight of our programs and helping us with our mission. And then short, sweet, school. No, that's okay. I know some are looking at their iPads, some are looking up there, I don't know. They're down on page 8. And we do a condensed org chart in here. We don't do the full-blown org chart in here. We just kind of do a condensed org chart just so you can kind of see kind of where we fall, right? The committees, where they fall. And if you scroll down, then it's an agency, what's that, condensed, just so you can kind of see the units and where we all are at. And then I have a special request. One of the managers has a prior commitment and has to get out of here. So public health, Brandy Anderson, she's gonna go out of order here a little bit. So you can jump to page 43. That'll be. And she's going to do a summary of her programs within her unit.
Thank you, Stephanie, and thanks to the managers for letting me jump in first. I appreciate that.
I'm gonna be very broad over very, very quick. We're almost there. There we go. So the public health programming or essential services reflect the foundational public health services model, FPHS, that's out there frequently in the public health world. And that framework encompasses communicable disease, environmental health, public health, maternal child health, access to linkage care, chronic disease, and injury prevention. So if you want to keep scrolling, we have to do every 3 to 5 years, we do what's called a community health assessment and community health improvement program. That was completed the health assessment was done in 22. The community health improvement plan was published in 23, and it was implemented actually in 24. Stephanie mentioned we had Evan Ewing here. He was one of our public health specialists, and he actually was a health educator by training. So he was really key in moving that work along for us in the Richland County Public Health Unit. So you can see our data there. This year, our public health annual report, we had also a public health intern, and we tried to highlight the data this year. Like the numbers, why we try to focus what we do, our services, and what we're actually providing. Some of these essential services are just mandated by state statutes. You're kind of asking about like some overlap in services. So local health departments are required. It's mandated, we have Chapter 252, DHS Administrative Rule 140. Basically gives us our marching orders about what we have to provide as a local health department minimally. Depending on the level of health department you are, that can look different from health department to health department. Your level of funding, your level of staffing. So as you saw from the org chart, we're just a small but mighty unit of 3, or hopefully get to be 3 again. The other public health nurse that helps me is a contracted nurse. She's not here full time, chooses not to be, but I'm really grateful for her. So jumping back into the annual report, we have this CHA chip that is done every 3 to 5 years. We're on a 5-year cycle, so that'll be coming up again here soon. The two big areas for our county that were identified were substance misuse and mental health. And again, like I said, Evan Ewing, all of his stuff along this page and the next page is highlighted really well. It breaks down all of the work that was done. On the next page for the mental health, he was able to do a lot of, he facilitated what's called the mental health work group monthly with some other people in the community that attended that. He just did the, like Stephanie mentioned, the Make It Okay to reduce mental health stigma. He's done that in the community, and he did it for our agency. And our goal within our public health unit is to continue to train public health staff to be ambassadors of that Make It Okay training moving forward. We are going to continue to do the mental health work groups, but we're looking at maybe, depending on staffing, looking at that scheduling and kind of changing that to maybe bi-monthly or quarterly moving forward. It just depends on what we can arrange. So yeah, a lot of the actual specifics of the work he did is located in the report, which I'll let you read. I'm not going to read through that. I'm going to move on quickly to preparedness and response. If you could scroll through to the next page, please. That's an essential public health service. We do have to have, we have what's called FEP public health emergency preparedness. We coordinate with our state HERC region. We're in the Southwest region for HERC 5 for preparedness. We attend, me as a health officer, regional, what's called Wisconsin Local Health Department and board meetings in our southern region and connect as local health officers, what we would do as a region. We would be doing a lot of regional work and connecting with our local emergency management for those, high disasters. We do what's called training exercises, tabletop exercises. We recently just did a measles shared exercise with our local health system, the Richland Hospital, with public health, emergency management here. So whenever those training opportunities come about, we minimally will try to do at least one tabletop or functional exercise per year. A good example of this, real life, was the COVID era pandemic. That was basically real life emergency preparedness priority area. One of the things that we do is mass vaccine clinics. We offer those to the schools every year. That actually comes from preparedness funds or preparedness type of allotted vaccines. So that's what we use as one of our real life preparedness exercises every year. Moving into immunizations and communicable disease, like I said, that communicable disease is one of the essential services we have to provide. That's our numbers from the wheel there, highlights the data as far as immunizations given. Just to note, the numbers reflect that we give to uninsured, underinsured populations. That's what our vaccine that we have to provide to the public is. People that have insurance have to go to their health systems. We cannot provide people with insurance those vaccines. So you have to qualify for our vaccines. We provide those every single month. We have standing clinics. We try to promote those. We've done some activities to promote those on social media. We've revised our schedule to make it, maybe more appealing and digestible. We put it on our website. So we just don't see a lot of people coming in for that, but we do our best. Betty is really great with specifically the Amish population and Amish outreach, so she's been really helpful in that. Could you please move to the next slide? This just breaks down some more specific things about VFA is vaccine for adults, VFC is vaccine for children. So adults can get vaccines as well if they're uninsured and underinsured. I thought what was interesting is we had a few more adults than children last year for 2025. So just kind of something to note. I don't know why. We just did. Please scroll to the next page. Communicable disease follow-up. So that kind of goes along with immunizations, preventing vaccine preventable diseases, but then sometimes we do have to follow up on specific diseases, whether you can be vaccinated against them or not. We have to provide follow-up on certain diseases. We have 3 categories, Cat 1, Cat 2, Cat 3. The state handles Cat 3 diseases. We don't do those at the local health department. One example of that is HIV specifically. That's all state. We're not supposed to know that level of detail for the locals unless it's something that we really have to know. Some of the other higher level diseases we handle within our health department and we prioritize those. Some diseases are just reported, we note them, we do very minimal follow-up on some of those, and then we close the cases and review them. You can see the wheels here highlighted, kind of some of those areas. We have the different categories that we kind of group those into. I'm not going to read through those, but of note, she mentioned that Evan Ewan had handled the tick prevention and Lyme disease prevention campaign. That was a specific pot of money. We were able to secure a mini grant last year, the Taking Action with Data grant, and he focused, because of this information that we saw in the data, we tried to focus that priority area to reduce Lyme disease. That's an endemic disease in our state. We have high levels in our county, so we really wanted to focus our efforts to reduce Lyme disease and any other tick-borne disease prevention. You can scroll to the next category, or the next page rather. This is just kind of the breakdown of the diseases, just a different chart highlighting what that looks like. Kind of gives you the last 3 years for context and the trends. You can go to the next page, please. The TB skin test and dispensary, tuberculosis, a very severe contagious disease. We do a lot of TB screening for local employers. Employers have to have TB screening in place. We have a lot of adult family homes and CBRFs that have to screen their employees rather. And we provide that for those employers. And then anybody can actually walk in for a TB skin test if they want to pay for it. So sometimes we get some walk-ins or like students that'll have that. And that wheel kind of breaks down by number how many TB skin tests we're doing. We also respond to what's called latent tuberculosis infection. So you can be infected with tuberculosis but not have the disease. So we do provide outreach for people that may have that infection. We can access the TB dispensary to treat that infection so it doesn't develop into tuberculosis disease. We have had to access the TB dispensary a few times each year now for the last few years. You can move on to the next page. So this again, we have rabies prevention and control. So rabies is a mandated, we have state statute language that says we do have to have some type of rabies control program. So this is specifically deals with a lot of animal bites. Domestic animal bites is usually what we respond to. In coordination with law enforcement who reports to the health department, and then we follow up with animal owners and victims. These are sometimes very time-consuming calls. As Stephanie mentioned, we just had an uptick recently. We actually had 5 come in last week. So that's not usual for a week, but that's a lot of work for 1 week on an animal bites Also included in that are things like people will wake up and maybe find a bat in their home, or they'll have some type of bat exposure. So we have to advise people to, take their bats in for testing and coordinate that with the state lab of hygiene. So that kind of reflects all of that work. Yes, ma'am.
Does the bar chart represent what time period?
The bar chart is from last year. This is last year's data. I'm sorry.
You mentioned state mandates for this. Are they funded mandates or unfunded?
Well, sort of. It's under the communicable disease blanket of programs, so we do get some little bit of communicable disease money, but not. It's under one big pot, and it just kind of goes in with all the communicable disease funding. It's not much.
I mean, I want to say like $8,000. I mean, it's not, I'd have to add it up, but.
Of note, we're talking about this at the state level and regionally. We just had a meeting about this yesterday about just all of these really strict requirements that go into animal bite reporting. We're all struggling as local health departments to respond in the capacity to take on some of this work and all of the work required that we have to do on our end. So there are bigger conversations occurring about implementing change for that state statute to language to maybe help out locals a little bit more, just so you know. I don't know if that change is occurring anytime soon, but we're really advocating strongly for this because we're really struggling.
Unfunded mandates that they have.
There seem to be a lot of mandates that we have to work under, just the funding that we get, right?
Yeah, we're seeing the same thing with the ambulance. It's really interesting. Mandated services require.
Under
Thank you.
mandates. Thank you for the question. So you can move on to the next slide. Again, I talked about the Taking Action with Data grant that we had that actually ends in July. Evan Ewing did a lot of wonderful work to promote this. You might still see the billboards out there for this. Tick prevention, Lyme disease, anaplasma, or ehrlichiosis, or some other examples of tick-borne illnesses, but we really targeted Lyme disease because that's the most commonly reported. He did like some really neat tick building events with youth, did some morning show promotion, put together these really great tick kits, distributed them at community events. So yeah, he also put some things in county parks, Deep Woods Off Lake. So
$5,767 for communicable disease control.
Yep. Thanks, Stephanie, for getting that. And that's, you can keep going on to the next slide. This again just highlights that Taking Action with Data grant. He broke down all of the tick kits dispensed and where he did that information in those community presentations. You can keep going. So the maternal child health program, that's another essential service that we have to provide maternal child health programming. We had previously done breastfeeding as an objective. The states reduced our options for objectives, so we had started on the physical activity and nutrition objective last year. We were starting into year one with that, and then that was pulled, and they decided to narrow it down even further. So now we've chosen adolescent and mental health, adolescent well-being and mental health, because it kind of also aligns with our CHIP and CHAW work, right? So trying to kind of do two things that would cover a couple of important programs. We also do home visits, and we get referrals for new families and new babies born in the county. We dispense birth packets with information to all reported births and families to the health department. So that gives you the numbers of the birth packets distributed. And they do a lot of work to update those, and we've done some work to kind of do some digital things in there too, because we live in a digital era. So not just things in print, but also things that people can like scan like QR codes to read. So we've really worked to update that information for clients. You can move on to environmental health. Another area, environmental health can be quite time consuming. Some of these are very challenging cases. We do some home visits to address some more serious concerns. Sometimes they're just calls, and we provide education and resources on the phone. So this gives you kind of a summary of some of the most common common calls we're getting, and some of the information that we're giving and teaching. You see DAT cap at the bottom, that's the Department of Ag Trade Consumer Protection. Often we have to defer to DAT cap at the state level for some of these concerns because those are concerns that the state handles and not local. So, yeah, you can see unsafe, unsanitary conditions. We get quite a lot of those concerns. Mold, non-functioning building facilities, sometimes some vermin. We get a lot of those this time of year. And then waste accumulation. You can go ahead and move on to the next page. Another environmental health thing is we dispense radon test kits. That gives you the information about that. That's a very serious disease that can cause cancer. And we are able to dispense free radon test kits because we are in a region that allows for us to do that within I think it's a 5-county region. So Grant County gives them to us and then we dispense them at no cost because we receive them at no cost. So that's a really great opportunity. You can go on to the next slide. We have what's called the well tap private well testing. So some well taps, some people qualify for fee exempt testing of their wells. So at no cost, we can provide those to people that are eligible if they have certain health conditions, if they're pregnant or, babies in the home. We can dispense other test kits for at cost that we would get lab results on as well, but they would just have to then pay a fee depending on what they want tested, what substance they want tested in their well. And that breaks down the work that we've done with the well tap program. You can continue on. Childhood lead poisoning and prevention. So lead prevention is also something mandated we have to work on. We get reports of elevated lead levels, and sometimes we have to do home visits for elevated lead levels and try to determine the cause of why there's, what are the lead sources? Are they coming from the home? Usually it's environmental. So, but then try to make sure that they're connected to their healthcare providers and make sure that they're getting their routine follow-ups to make sure that those lead levels are dropping. We give them information. This is also a very nursing specific thing. I have to talk to them about diet and things to reduce the lead level in their blood and make sure they're connected to their doctors for that good follow-up. So you can go on to the next slide. There was a lead and water testing and remediation initiative that was specific to testing daycares. We did get that specific grant, some money to test a couple of daycares. We had 2 of the 4 licensed in our county that accepted. We did really try very robust efforts to get all of them tested, but they had to agree to it. So we did get the 2 done, and that was some things were identified, and there was some remediation involved in a couple of those daycares. You can move on to the next slide. So we have a loan closet at Health and Human Services. I don't know that this is under any of our mandated or essential services, but we have a public health specialist that is actually in charge of maintaining the inventory and all of the things, loan closet activities. He's done a really good job this year. We've dispensed a lot of equipment this year from the loan closet, along with our main front desk, our administrative staff that also helps with a lot of this work. So you can see our numbers really jumped up this year, and a lot of people are using and renting out equipment, the wheelchairs, the canes, the walkers. So
I think it's a marvelous program.
yeah, thank you.
I'm gonna say, we've tried to close it. We get a lot of pushback.
Yeah, the numbers kind of speak for itself.
Speak for themselves.
Use-
This, also too, this is a self-sustaining program. It's completely outside of the county's budget. So it's standalone.
I think that was the last page for public health. Is that correct?
That's correct.
Questions
West Nile virus, do you have any issues with that?
with West Nile? Sometimes we get an occasional report and it's usually suspect and it's not confirmed. So once in a great while, we'll get a West Nile report, but it's not anything that's on our radar that we're seeing any huge trends in our county. She did really quick. I do want to mention it'll be in the July committee report. She mentioned hantavirus. Ebola is on the news now, and we're keeping an eye on that situation. Currently, we've had some really important messaging from the state and just kind of more of that situational awareness right now. Right now, Richland County, we have no risk as of now, knock on wood. But, that was occurring in the Democratic Republic of Congo and I think Uganda and Sudan. So people are being monitored, there's specific airports monitoring, you know, people coming into the country. And then we have like, connected with like our local, partners and state partners just to monitor that situation as well. So that's the other emerging disease in the news internationally of concern. Any other questions?
I have one. You give out your birth packets and you report the births to the state. Did I get that right?
So the state actually reports births to us,
I
to the
see.
county. There is a mechanism where births are reported to the state. I know this because I used to work on that side of it. So at hospitals, when babies are born, or even like home births,
Mhm.
they have to be reported to the state. And then there is a portal to access. So we go in there, I think every couple of weeks or months is how we've been doing it. And we retrieve that information, and then it gives us some data about like birth and then the number of children born. And then we try to tailor that information to the families when we provide that.
Because I know we're getting more and more Amish in our county. And I was wondering if those births are
They are.
reported.
They're
Okay.
reported. Is there another question?
Anything else? Thank you.
Okay, thank you for your time.
Thanks, Brandy. So we can go back up to page 10, Miranda, thank you. So I'll just talk briefly about the Administrative and Financial Services Unit. Really, that's the support team for the agency. It's just a small list of some of the main things that the support that they provide, you know, as far as paying the bills, committees, committee support if needed. They do the insurance billing. They completely take care of the main front desk, so do all that reception work, provide information, make sure that people that come in get to where they need to go, and then support each of the units and, you know, for anything from scanning documents to, you know, paper filing, you know, all these things. So really important to have them around. I know I talked earlier about, you asked about levy. I know there's a lot of levy in the administrative positions, but the agency couldn't, agency is really in need of those positions. And every way we can get reimbursement for them, so it's not such a tax levy burden, we try and do that. So if we scroll down a little bit, I think one of the biggest highlights in 2025 for that unit was Tyler Technologies and the ERP Pro implementation. It really made them relook at a lot of their processes for how they pay the bills to how they deposit all the various funding and that thing. So it really changed the shape of the financial specialists' work and the work that they do. They continue to work really hard to do billing every month for all of the different programs. So we're making sure to draw down those Medicaid dollars efficiently. The WIMCR reporting was also successful. That's usually a group effort with pulling together all of that data so that we can maximize the revenue we get from Medicaid that way. And just that overall operational administrative support. We did have some turnover, main front desk. We had somebody go off and have a baby and just decided not to come back after having the baby. And who can blame that person, right? So there was some turnover there. So really trying to keep the ship moving with those vacancies. So a lot of cross training ended up happening. So somebody that didn't necessarily know how to scan, they know how to scan now. So a lot of work done that way. So thank you to them. Scroll down. And then also in here, we kind of put a a financial summary for 2025, totally unaudited. But you really, if you go back and you go look at the final report for 2025 that was presented to committee, this is just after doing some posting back and things like that. This is what we came up with based on the reports in Tyler. We budgeted 8.8 million, ended up spending 9.5 million. If you look, you can see $1 million of that was just our comprehensive community services program. So just the growth in that program was huge. So that was there. And then if we go to the next page and we kind of look at revenues, you'll see that there is a core budget balance of a negative 205,000. I would not get too worked up about that. Just so what's going to happen is that WIMCR that I talk about, I will do. So for 2025, we had that increase in those CCS expenses. What'll happen is right now we'll start doing the work to get reimbursed for the difference. For some of the things, because we only get reimbursed an interim rate, and then we have to do this reporting to get the difference back. So if we were to look at unaudited, this is kind of what I came up with, knowing that that the budget at the end of the day will end up, if we ever go back and relook at it, it would not be as impacted because of that WIMCR money that we expected. So. But on a positive note, our placement expenses, those funds ended up with good balances for the end of the year. So, so that's on a positive. So, the other thing I look at too, and it's not on here, is we kind of look at cash balances as well. So in our different funds, we have cash, kind of like a checking account. So even though the budget might be negative, the cash balance in that fund is okay enough to support that. But our placements ended up good last year, so, which is good. It'll hopefully offset this year. And then we just did a summary of all of our contracts that were over $10,000 in 2025. Just a restatement of some of our contracts. So. Any questions about admin and fiscal or? Right. Then what do we got next? Behavioral Health Services Unit. You're up. I know, I was thinking alphabetical. I'm like, this should be aging. So like, okay, it's not. It's behavioral health. Okay.
Before you ladies start, does anyone need to take a break? Get up to stretch their legs. If it's okay, I'd like to take a 7-10 minute break. So please be back here at 10 after 12. I need to go move my car before I get tickets too. So.
You too.
Yeah, yeah.
Oh.
So all those in favor of taking a 10-minute break, please say
And a
aye.
report, please.
And all opposed? Okay, 10-minute break. 12:13. Back to order. So moving along with the Health and Human Services Annual Report. Please continue, ladies.
Hi, thanks for having us. I'm gonna start our overview of our treatment court. So in 2025, we had 3 people in sobriety court, 12 in drug court. We had 2 graduations and 4 in drug court as well, and 1 application for sobriety court in 2025 and 6 for drug court. Treatment court's not a mandated position that we have to have. Questions over treatment court before we move into outpatient clinic?
How is that funded?
Our TAG grant and our, what's the new one, right?
It's through TAG grant and tax levy. There's a match.
Can I ask you to speak up a little bit?
Absolutely.
Yes, Rod can't hear you. I can't hear you either. So.
All right, we'll go into our outpatient clinic as well. 2025 behavioral health clinic completed 79 intoxicated driver assessments, 24 mental health assessments, 51 substance abuse assessments, and 5 for Prime for Life graduates. Any questions on those numbers?
Is that a mandated clinic?
No, it is not. However, looking at our numbers, it's more preventative care, such as if we didn't have Haley and our providers there, our crisis numbers would be a lot higher and our emergency detentions would be a lot higher. So potentially turning into more of our tax levy dollar for placements.
Yeah, so just a couple of years ago, we tried to get a telehealth clinic psychiatrist. Profit margin is strong enough.
Correct. And with Dr. Haley, our laws and nurses meeting that they have to come in person at least 1 time a year to see her face to face.
So I guess my question is, back then, our diagnostic ability in the county was very weak. Is it still weak?
Median,
Because the need was really intense.
the need is still there.
Yeah, we did a thing of zip codes and looked at medical for prescriptions.
Mhm.
And there was a high volume of mental health issues.
Yep, prime example.
Services which were almost non-existent.
Correct. So prime example with having Dr. T and Dr. Haley available for our placements if we get moved for adult family homes, being able to emergency get in and squeeze them in to see them in telehealth to establish care eliminates that to potentially go under our crisis. So Dr. T and Haley, squeezes our clients in to get them, we get telehealth to be able to assist and keep going with their medications and all of that.
So this is a direct result of not having the chapter, whatever that number.
Clients we serve, accomplish, yes, sir.
Thank you.
Could you also talk louder when you chat to us?
Sure.
I have a question. Completed 79 intoxicated driver assessments. Is that for people who have
OWIs. Yep.
and lost their license through a court system?
Correct.
Now, how do they contact you?
Through the courts. They have 72 hours to do that. So every county must have an assessor and I'm the backup.
Well, question for you is, what if it's a different county that took the license, but the person lives in Richland County now?
We only do our county,
Okay, even though this person now lives in Richland County?
only our county.
Okay, so they have to go back to South. Okay, well, good, thank you.
Yes, ma'am. Any other questions?
Wait list. Is it long before they can see?
For OWIs,
Yeah,
for the assessment? Is that what you're asking?
Yep.
No. Nope. They have to,
so that number has come down.
correct,
It used to be a couple of weeks.
correct. We now have me as a backup and also our AODA person certified in as well.
Great, thanks.
In 2025, our Northwest Connections, 350 crisis contacts. 2025, we had 23 individuals on settlements and 19 individuals on commitments. Questions on those numbers? Right, moving on to our adult protection service, what's I've been actively involved in for this year, but in 2025, there's 150 APS referrals, the adult protection referrals. And for 2026, we currently will have 100 plus clients and are protectively placed through APS. Any questions on those numbers?
That's just a shame.
Not at all. If not, I'll turn it over to Ms. Boyd.
I do have a question
Yes,
about that. Earlier, we talked about children and how their numbers, the number of reports for children decline in the summer months. Where are the primary sources of the adult?
All year round.
But who's referring that? Is it they call themselves or someone or their
Anyone can make a
medical
report.
provider?
Yep, anybody can call in. We have 24 hours to do something with the report. So we've made it more accessible on our website to fill out a referral form to call it in. They can call the front desk, any of those sources. If they know somebody personally in the unit, they can send an email and then we collaborate together to see who goes out. Also, now our crisis worker and APS will be cross-training each other, so it will happen a lot faster and I'm their backup as well.
And is the source tracked? Do
Yes.
you know? So what, in Richland County, who are a couple of the top reporters of that? Is it
Neighbors,
neighbors? People that hear.
yes.
Right, CCS is Comprehensive Community Services, so this is our wraparound mental health, substance use program. It is fully funded by Medicaid. We served 80 consumers in 2025. We have 3 workers that do straight CCS. And then we have 4 workers that also do dually enrolled children with disabilities and CCS. Services are based on need. We complete assessments, service plans, and then it's consumer driven, voluntary, so they can choose their providers. Any questions on?
The need growing,
Yes.
how would you define it? Because we see like books like The Anxious Generation out there and stuff. Just what do you see in your local?
Just the trauma, increased trauma, abuse, neglect.
And I think it's important to note in regards to comprehensive community services, it's above the typical outpatient need for mental health services. It's intensive, meaning they can't be successful with just going to a local clinic. They're needing more intervention to be able to reach independence or some level of independence, which I think is, when you're speaking to like what is a rise, we're seeing more individuals who are needing this intensive level of mental health versus just that regular outpatient need.
Are they residents of Richland County
Yes, they have to be within Richland County.
for what, a year?
No, there isn't.
There's no time frame.
So it could be somebody that has transitioned from adult family home or juvenile home, out on the street homeless, basically. Could be.
Correct.
Have you done statistics on what those numbers are? Just curious.
As
Because I
far
know we
as-
have a lot of adult family, well, several adult homes here and juvenile as well. I'm just kind of wondering what percentages there are of these folks coming into our county.
We haven't ran the numbers at all. I mean, there's certain, like, we track referral sources. And I guess that, I don't know that that's, like, that specific scenario is tracked within that referral source. It's usually, those are usually coming through from providers or, other contacts that they're having with other agencies within the county.
Age groups? Are you seeing increases in certain age groups, like in their 20s, 30s, 40s?
And we have, I would say we have a large, across all ranges. I think we are seeing a little bit more increase in younger kids needing intensive mental health services, where before you're looking at teenage years, and I think we're seeing the need for intensive being younger.
Wow.
Reasons for that? Any idea?
I mean, I have my own personal or professional visions. It's
Okay.
more related to environmental and social engagement.
Or lack thereof.
Correct.
You saw statistics on higher teen suicide.
Connection. You spoke to the anxious generation and they gave a lot of numbers in regards to like feeling isolated, lonely. Very similar.
Do you work with the school districts much?
Yeah.
They're on our teams.
CCS.
Have you seen a correlation between early iPad use and anxiety and social disconnect?
That's for birth to 3.
Yeah.
What are we doing about that?
So if like you if you talk about that early exposure, that's where like our birth to 3 or early intervention program comes in. And we're really focusing on the increase of that parent education. There's a huge push for social emotional development and infant mental health, which is building the parents and the child's capacity to have better outcomes in regards to mental health, and overall well-being and the engagement between parents and child. That's when you're seeing the most results at those younger age ranges.
What about school districts though?
For like the comprehensive community services and children's long-term supports, yes, we try to team pretty closely with them. Having them sit on our teams with our mental health and our service facilitators, children's long-term supports, we try to sit on those IEP teams, and help have communication in regards to best support the kids. And that birth to 3, that early intervention programs, we team with them as they're getting closer to 3. So we don't work with the school district until they're getting about 9 months before they're turning 3, and then we're helping the family transition into the school so they can continue to receive that support, hoping to bridge the gap between where they are and where they should be by the time they're hitting school age.
That's a really good answer.
As far as how we're working
Were
with
you
it.
asking about the school's use of iPads and
Yes.
things like that?
Yes.
Encouraging more learning via.
Yes.
We don't have a huge connection in regards to policy that's coming out within the school district. They talked about that mental health community outreach we did. So like Evan, myself, another CCS facilitator helped with collaborating with that. And those were definitely conversations that the public was having. We did have some administration from the different school districts sitting on that board, and there was conversations around that. Obviously those outreaches don't have the capacity to change policy within the school, but there was talks about why is that happening and how as a community we can come together and support some of those changes.
I've noticed too that when we've had county government days here in the courthouse, the kids are on their cell phones constantly. And they'll be texting each other, but yet they're standing right next to each other. And it's like, what is that? So, so I don't know. I don't know what, it's just, it's a pandemic. It's a pandemic. Everybody goes to the blue screens anymore.
Yeah. And I think some of that's the mental health that Randy was talking about as far as mental health outreach to the community. Some of those are things that they're working with. Within our birth to 3 program, we certainly have those conversations with those families that those younger in interactions and services.
So tell them just to keep quiet.
Yeah, so our work in that program is to really help facilitate that engagement and understanding of child development and mental health outcomes.
Be nice to see some outreach to the school board. I don't know if that's possible, but I work in the schools part-time and I really see it with the special ed kids. And if the district can have any kind of information as to the negative effects, make some policy changes, I think that would be really good.
A question here?
This starts way before school age,
Correct.
and it's parents' phone. Those kids at 2 or younger can learn how to run that thing, and then they want it. Personally observed that with great grandchildren. They want that phone and they know what it'll do. So
Yep.
scary almost.
Their brains at our age are very malleable and they learn things very quickly. And the hope is that we're teaching them to learn social engagement and mental health skills, not how to.
Right.
Any other questions on CCS? We can kind of, we get a couple other programs in here.
I do want to loop back on CCS. I think that's a program that's has been super helpful in helping prevent placements, those more expensive placement costs, right? Because we're able to work with these individuals in the community, keep them in their homes and all those kinds of things. So when you ask about Driftless, that's what they do. They do a lot of work with that program to keep individuals still in their homes and things like that. So we don't have these crisis and these emergency placements and all those things.
So did I hear that the Driftless group is an example? Are they in Viroqua? And so,
But thanks.
yeah, and so do our residents from Richland County then, do they need to travel to those locations or do they all come here and be?
Riders go to that. So we can offer, CCS offers psychotherapy, psychoeducation, individual skill development, a range of services, which again, it's a team approach
And it's mostly in the subject of home.
for the community, working on social skills, coping. That again. All right, so children's long-term support, which is the waiver program. That's the federal program, which I see we don't have CCAP in here. Children's Community Options Program is not touched, but they go hand in hand. One is federal, one is the state. We work with children and families with disabilities. We provide services, supports to keep them in the home. Examples, respite, adaptive aids, camps. The waiver can fund everything except for pure recreation, which CCAP could fund. This could be the Simons family passes or the outdoor pool passes. But again, those are all, it's all fully funded. And they get case managers, and then the case managers connect the families with, it's all based on need. 95 children were served in both programs in 2025. So we have 4 workers. Any questions? CLTS or CCAP? Then birth to 3, early intervention for children ages birth until age 3 who have any delays or disabilities. We do a primary coach approach model, so it's really about coaching the parent, provide the services to the family. We do a speech therapist, physical therapist, supposed to have an occupational therapist we have in a couple of years, and then case manager. For the 3 we served,
Is that income based?
37.
No, anybody can receive birth to 3 services. It's all based on, if they have a delayed disability or they have a concern that would lead us to believe they would be delayed with health service.
There may be cost share. So higher income families would have to pay a portion of services. Which is same with CLTS. They also pay a portion if they're higher income. Learning services, we no longer have that program, but we did in 2025. And that was a wraparound approach too for children that had mental health needs that did not have Medicaid. Because if you have Medicaid, CCS, serve you in CCS. And that was a match. And I think we did,
Pretty big match.
but we no longer, 2026, we stopped providing CST. Due to enrollment numbers, there was no enrollment, lack of referrals.
Not due to lack of need.
Probably not, no.
But that does kind of speak to poverty levels, right? That means we probably have a significant amount of these children that are probably Medicaid eligible, would be my, so kind of a.
Are you saying autism is one of these conditions?
So autism's huge. And for CLTS, families that, we can also provide them with Medicaid. They can get Medicaid through that program. They don't qualify.
Does that work?
They have to meet a functional eligibility screen, and then we do a financial. And then the state provides the Medicaid. There's also Katie Beckett Medicaid coverage, That's for high income families. We will refer to Katie Beckett if they're higher income, because that Medicaid can stay with them through 19. But we would most likely end at 18, because we then transition to family care. We would transition our CLTS kids to a family care program when they reach adulthood.
It's to ensure any kid who has a disability can get the medical and additional supports needed to help ensure their safety and staying in the community.
How are situations addressed when there clearly is a need for the child and the parent doesn't accept that there's a need? Are you able to, does it require the parental cooperation?
Yeah, we're all volunteers.
They're voluntary. Parents are required to parent. So we can't, so for example, if they need a fence, we can fund a fence if it's due to disability. But if it's due to lack of supervision, we really want to say, and we also want to be cost effective. So before we just fund a fence, we'll try door alarms, window guards, parenting support. Questions on our programs?
Thank you.
Thank you, Louise. Thank you. Now we have the Aging and Disability Resource Center.
So I'm Roxanne, I'm the manager for the ADRC. I've been with the ADRC for over 13 years now. So the ADRC, there's an ADRC in every county and tribe in the state of Wisconsin. We are part of a 3-county region, so we serve only Richland County, but our region is Richland, Crawford, and Juneau. And our goal is to assist people with resources and programs to keep them as independent as possible and in their own homes as long as possible. So we have elder benefit specialists that work with individuals who are over 60 years old. We have a disability benefit specialist who works with individuals who are 18 to 59. We have our ADRC specialists that work with youth in transition. Once they hit 17 and a half, they actually work with the CLTS program to transition those youth into adult programs. And then they work with people that are 18 and as well. So last year in 2025, the Richland County office processed 14,610 incoming contacts from community members. So that could be through phone calls, walk-in customers, and so forth. Yeah.
Wait, no, 17.
Yeah. Information, referral, assistance, and options counseling. So our ADRC specialists do that. We have 3 of those in the ADRC. These services are provided, they're through walk-ins and home visits, phone calls. So in 2024, they had 4,721 contacts. We were under an old reporting system at that time, so our new reporting system no longer tells us how many contacts. They actually tell us how many unduplicated consumers come in and work with our ADRC specialists. So in Richland County, which I thought was pretty significant when I looked at this number, 2,266 individuals walked through our doors just for our ADRC specialists. So that was huge. I think thinking about contacts is big, and when you think about 14,000, but that could be, one person making multiple contacts. But when you think about the number of people that those 3 staff actually touched in 2025, I think that's pretty impressive. So they also are the doorway into publicly funded long-term care programs. And so they do a functional screen, and then we work with our economic support unit to assist people with obtaining Medicaid funding if they do not receive that. So people have to qualify for both Medicaid and they have to functionally qualify as well through our functional screen. Our functional screens, staff are trained through that. They have to be recertified every 2 years. It's a very cumbersome process. So they do those. So last year they did 87 functional screens, and they enrolled 80 people into long-term care programs such as family care and IRIS. So that would be like Inclusa, if you've heard of Inclusa, or My Choice Wisconsin, or TMG. And each one of those enrollments takes them an average of 8 to 12 hours of work. So if you think of it that way with 80 enrollments, at age 12, even 10, that's 800 hours of work on top of the other things that they do.
So what are some examples of what requires that length of time?
So they first meet, so when a person comes through our doors, they will meet with the individual, see what their needs are, and then they will do what's called options counseling. So they look at the individual situation and talk with them about what their needs are. If they just need some basic resources for, maybe they need an in-home service, however they can pay for it themselves, we'll give them resources for that. If there's somebody that needs those long-term care supports, then it moves on to a more in-depth options counseling. That option counseling can take 1 to 2 hours just for that counseling portion. That's a time where they sit down and they talk about what are the options are out there, what's their personal situation, and then what's the process going to look like to obtain that long-term care. From that point, then if they don't have Medicaid, they assist them with the Medicaid application process, which that Medicaid application process takes a lot of time. And then from there, they also have to do the long-term care functional screen. So the functional screen is very in-depth. So they look at every aspect of a person's life and functioning. They have to get information from Social Security if they have disability. They also have to get information from physicians. So they can't just do a screen. They have to wait for that information to come from the doctor. Once they input that screen information, then the system actually tells them whether they functionally qualify or not. From that point, once Medicaid is approved, then they have to do what's called enrollment counseling. So they sit down for another hour. So go through what are all of your options for enrollment. And then from there, they have to do the enrollment. So there's multiple different steps to it.
I like to think of it as a one-stop shop for aging.
Yeah, it's quite the ordeal.
Quite impressive.
So we also have our disability benefit specialist, which I mentioned. So she started 2 years ago. So she actually works with individuals that are 18 to 59. The assistance that she gives is applying for Social Security disability, SSI, medical assistance, Part D, and other types of appeals for like insurance issues and so forth. So our disability benefit specialist saw a large increase from 24 to 25, but she started in 2024. So that position had been open for a couple of months. So that's why we see her numbers are much higher. So you'll see that in 2024, she worked with 142 people. In 2025, it was 283. The other big part of our disability benefit specialist program, which when we look at what does that disability benefit specialist, how does that help Richland County? It's in the monetary impact. So when they work with an individual and somebody gets disability or gets different types of programs, Medicaid, whatever, that's called monetary impact. And there's a formula that the state has that tells us how much is that monetary impact. So if we look at 2024, monetary impact was $658,000. In 2025, that monetary impact for individuals receiving services because of the disability benefit specialist was over 1.3 million. So that's money that the individual is spending on, paying rent, paying for their food. So all of those different things, paying their taxes. So things like that. So that's, if we look at that, your return on investment, which there's no tax levy in our disability benefit specialist, but the return on investment is huge. Let's see here. Okay. So then our other benefit specialist is our elder benefit specialist. Our elder benefit specialist also started in 2024. We had somebody that retired. She had been in that position for over 20 years. So you'll see there's some differences in our numbers for that as well. Our elder benefit specialist works with individuals that are over 60. They can assist with SSDI, SSI as well. They do a lot of Social Security retirement, a lot of Medicare, Medicare Part D, Medicare savings programs. So the same types of things that the disability benefit specialist does, but also for people 60 and older. They can also do some advocacy as well surrounding housing and just a really wide variety of things. So in 2025, our numbers were at 263 individuals that she assisted. When you have somebody that's been in a position for over 20 years and they really trust that person, it's hard to then start over and build rapport. So a lot of people were like, Joanne's gone. so now she's starting to see her numbers increase again, over 25 and into this year.
Well,
So-
that's your daughter-in-law.
Yeah, once she says, that's my mother-in-law, people tend to say, oh, okay, and then they're comfortable again. So in 2025, so 2024, our monetary impact was 1.369 million, and 2025 is 1.323. So about the same, but again, it's that amount of money that comes back into Richland County because of these services. There is tax levy, required tax levy in our Elder Benefit Specialist Program. It's an Older Americans Act program. So the federal government requires that we have that program and requires that we pay a percentage for tax levy, for match. Our next one is our early intervention prevention services. So this program, this one is probably one of those pet programs that I'm proud of all of our programs, but this program, we get about $2,600 a year is all we get in federal funding. And then we have our 10% match. So for $3,000 a year, we actually partner with Simon's Recreation, and they actually do our services, a lot of our services for us. So we're able to provide a lot of different programs for that $3,000 and make a huge impact within the county. We also partner with Vernon County, Grant County, and Iowa County to provide these programs. So we have, we've really built a strong relationship with Simon's, and we offer Tai Chi, usually 3 classes a year, strong bodies, usually 3 classes a year, physical activity for lifelong success, and then staying active and independent for life. So in 2024, we actually served 46 individuals. 2025, we served 101. And those 101 individuals logged 557 hours for those programs. So when we think about that, our last class was $16 because it got split between 3 counties, and people, we have to offer them a way to contribute so they can do voluntary contributions to the program. So most of them will pay $20. So for $16 for that program, Simon's was able to put that on for us. So I'm pretty proud of that program.
And these are offered other than just at Simon's.
Yeah.
There are also outreach
Right.
classes for some of these.
Yes.
Other-
So we have classes at Simon's and then in Lafarge and in Muscadet. So we're hitting those border communities. We see a lot in the ADRC, people say, everything's in Richland Center. And so we're really working hard to get out to those outside communities and those border communities to make sure that we're hitting all of those individuals.
If Simon's didn't exist,
So before the partnership with Simon's, we did 1 class a year. That's all that we could do because it was, our staff had to do it. And so with everything else they do and us being a small ADRC, we just didn't have the capacity. We do actually now offer bingo size as well within the agency, which is a pretty much zero cost program. We have numerous staff that have been trained in that. We received a lot of ARPA dollars, so we were able to get staff trained to be able to do that too. So we'd probably be able to do more now, but with the impact that Simon's Recreation can make, and that's what they do. They're the experts in that. So why wouldn't we have the experts do that? Next one is our transition services for youth. So we work very closely with the behavioral health unit in this program. We have one of our ADRC specialists does all of our youth in transition. And again, that is transitioning those children from the child services into the adult services. So we work with local schools, any Richland County school. We do ongoing information assistance to teachers, so they do regular meetings for that program as well, and they partner with the schools. They also do specialized options counseling to youth and their families, leadership and participation in the monthly county communities on transitioning meetings. And with that, when you think about that collaboration, it's high schools, it's representatives of community organizations, so like vocational rehab, staff from other areas within health and human services too. And then we do ongoing outreach to all of the different schools. Questions about that? Okay, we can go on. Our Alzheimer Family Caregiver Support Funding. So there is no county match required for that. We get money from the state to be able to provide services for individuals and their families who have some form of dementia. So we can pay for respite, we can pay for If somebody needed an alarm, if somebody needed incontinence products, we can pay for a whole host of things as long as the individual has a dementia diagnosis, has a caregiver, and then also, is not on, if they are, is not in a long-term care program. If they're in a family care or IRIS program, they don't qualify because those programs should be providing that. So we provide that. We also do some support groups as well. Next slide, we have our dementia care specialists. So we have, every county has a dementia care specialist now. We share ours. We get a half-time one. We share that with Crawford County through the region. It has been a huge help for us and for families within our community. So they do individual consultations. She does Dementia Live, which is a virtual dementia experience where people put on headphones and goggles and gloves, and then they're given a list of tasks to do. So it's about a 7.5-minute experience, and then she does a debrief after that. She'll actually be doing it for HHS staff at the end of the month.
It's mind blowing.
It really is. I think families, it's such a good experience for families that do it because they come away from that and they say, I had no idea. Because when they have the headphones on, it's like sirens going off in their ears, you know, because as your brain changes, you're going to have changes with your hearing, you're going to have changes with your eyesight. So she does those as well. She's done it for law enforcement. Every year she usually does EMS and law enforcement as well. So that's been a very, very, very positive thing to have. She also does dementia capable crisis response training, like I just said. So she does that with law enforcement. Caregiver support groups. So we have a caregiver support group that meets monthly here in town. And then she's also helps with some online support groups and a new support group called Forget Me Not for individuals that have mild cognitive impairment so that they have support groups themselves. And then we started our program or getting ready for the men's shed last year. We didn't actually have a men's shed, but we brought together a group together to be able to create what's called a men's shed, and that is for men only, 60 and older, to bring people together to learn, to converse, to have lunch, and just have a social outing. And so we did actually start that this year, and it's been extremely successful.
Is this your brainchild or?
Actually, Juneau County started it. That was the first one in the state. And so Karen Schaff had retired a couple of years ago, but she and I went to the men's shed in Juneau County because we'd heard really good things about it. We were like, we need that. That was another situation where we were driving back from Juneau County and I said, we can't do it in Richland Center. As much as we want to do things in Richland Center, but we have to get outside of Richland Center and pull people in that are not coming. And so actually we talked to the Lloyd Community Center and they've been wonderful. They were like, yeah, we want to do this. So we've had anywhere from 17 to 25 men come. So, and actually our next one is next week and we have the.
Which is amazing, because, you know, it's been, I'm sorry.
I know. Oh, it's great. And it's funny because we have a lot of women that were part of the group bringing it together. So it's kind of funny because it was women creating this men's shed. We only had 2 men on the steering committee. But the women, they all kind of huddle together and stay out of the men's room, right? So like wives will bring their spouses and we have a couple people with early onset dementia, things like that. So it really is meant for men, geared towards men. And then all the women do then things like that. They do. So that's been really positive. So I'll be excited to report on that next year. We also have our Richland County Transportation Program. So that is where we have a lot of volunteer drivers. So you'll see those on the monthly reports of what gets paid out. They do get paid the federal IRS rate. We receive our funding from a state DOT grant. We have 20% required state match, and then also revenues from passengers and from the managed care organizations. So we provide driver escort program, public bus routes, public grocery routes, and on-demand wheelchair. So for our wheelchair program, our lift program for individuals that are confined to a wheelchair, this year we did 1,166 trips. Our driver escort program on the next page, please. That one we have generally about 20 volunteers. Pre-COVID, we had over 30. So we are really needing volunteers for that program. So in 2025, our volunteers, they provided over 6,000 hours of transportation. And then they traveled 179,000 miles. So we had a total of 4,155 one-way trips in 2025. So very robust program for such a small county. Most of the counties around us don't have programs like this.
So is this for transportation beyond Richland County?
Yeah, so
No to no place within.
So we can do, because of the way our grants work for especially our wheelchair van, we can do up Richland Center and out or bring people into Richland Center. We cannot do, if somebody lives in Richland Center, we can't just go pick them up and take them to the clinic because then we'd be competing with local taxi. So we don't compete with local taxi. The only time we do that is if they have a specialized need that the local taxi that they can't meet. So we make sure that what we're doing is taking those individuals that don't have access to other transportation to their appointments, making sure they get there. Our bus routes are meant for individuals to be able to, they might need to come in and get their groceries or have a doctor's appointment or a hair appointment or want to go to lunch. So we have routes 5 days a week. Next page, please. Our National Family Caregiver Support Program. So in 2025, we received $13,961, and we're able to put the majority that goes back out for respite services, consumable supplies, kind of like that Alzheimer Family Caregiver Support Program. You'll see a difference 2024 to 2025 for number of people supported. We had a lot of ARPA dollars, and those ARPA dollars came to an end. And so our funding, we lost quite a bit of funding through that from 24 to 25. So that's why you see that decrease there. And those individuals, either the caregiver needs to be over 60 or the individuals are caring for needs to be over 60. Okay, next slide, please. We have our elder nutrition programs. So we have Meals on Wheels and then our congregate sites. So we are able to provide home delivered meals out of 2 of our 3 locations. We have 3 meal sites, one in Rockbridge, one in Richland Center, and then one in Cazenovia. So we do provide Meals on Wheels out of our Cazenovia site and also out of our Richland Center site. So our Meals on Wheels, you'll see that our numbers dropped from 24 to 25. That's because our managed care organizations decided they were no longer going to provide that service, that they could do like a mom's meals and have bulk shipments of meals. And so if they are on family care, then family care needs to be providing those services. So then we don't provide those. So that's why you see a shift there from year to year. So that was over 3,000 meals per year. We are starting to see a shift back the other way because they're finding that those bulk shipments are getting wasted because people don't have the freezer space or they're not able to get those meals into their refrigerators or freezers. So now we're seeing a shift back to where they're starting to utilize for home meals. And then our senior dining sites, you'll see that those numbers went up about 400 people. So like I said, we've got the 3 meal sites, Richland Center, Cazenovia, and Rockbridge. The other thing we were able to do and we're super excited about is we started a Rise and Dine program. That started with a $5,000 grant from the Greater Wisconsin Agency on Aging Resources. That's where our Older Americans Act funding comes through. And so we did that in September, every week in September to see how it would go. The first week was like 22 people, and then it just grew from there. And so we actually served 46 new individuals who had never attended our programs. So this year we have continued that. We see the contributions for that program are much higher than what we get for our other dining sites. So we're doing it once a month. And so, for example, we had 66 people that came to our Rise and Dine last week. So, yeah. What's that? And the breakfast is great. People love it. Yeah, people love it. And then our final thing, I believe, is our senior farmers market. So we get senior farmers market vouchers every year, and so that's for individuals that meet certain income guidelines, and if they meet those income guidelines, they can get a $25 voucher to use at any Wisconsin senior farmers market that takes it, and it is only for Wisconsin grown produce, so they have to utilize Wisconsin grown produce. So we are right now, that just started June 1st, they're doing those programs, meeting with individuals, getting those out. And last year, we gave out 162 vouchers, and it had an 88% redemption rate. So the state rate is about 70% for redemption. Richland County residents redeemed it.
So based on our population and the other services that you see, are our meal programs underutilized, overutilized? What's your take?
I think they're about the same. You know, I think, you know, it's hard because if we compare to Crawford County's numbers are a little bit higher, but they're able to go border to border with their meal deliveries. We don't go border to border. So people have to live within a certain mileage of a meal site. And then we will do like a weekly delivery of one hot meal and then do frozen meals, but we just don't have the capacity to do border to border. So that's where we see people are not able to get that hot meal every day.
So we don't do Gotham local.
Yeah, we do Gotham and Lone Rock. So Gotham and Lone Rock, we're grandfathered in. So we do Richland Center within about 8 miles of Richland Center, and then all the way up to Gotham, Lone Rock. We have a route that goes out through Orion and then out through the port, and that way that goes once a week. And then Casanova, they do that area. The biggest area right now that we actually are trying to get volunteers for is the Rockbridge meal site and going out towards Yuba. We used to have a meal site in Viola, Baroqua, so we used to serve Vernon County residents because that's not a border to border. You know, we can serve people from other counties if they request it or come to us. So we had an agreement back then that we provided meals into Vernon County for out of the Viola meal site. When we closed that meal site, then Vernon County said, we're gonna start doing something in Viola. We'll serve Richland County residents out in that Viola area. So there is some service out in Viola and Lafarge as well.
What's restricting the capacity? Is it the number of volunteers that you have? Or?
Volunteers and honestly, fiscally. I mean, there's quite a bit of tax levy in the nutrition program just to be able to serve what we're serving. And in order to do border to border, there would be a lot. We'd have to hire another full-time person, probably a full-time driver. And fiscally, we just can't do that. Now, anybody can come in and get frozen meals. So we do have people that come in and do that. So when people will call us, we'll let them know, here's, what we're able to do. We can deliver a hot meal and, so many meals. So we have quite a few people that actually do that, and they're on those weekly routes. And we do have quite a few people that come in and get frozen meals from us to ensure that they have those meals. But yeah, right now we're not able to.
And then you have those people that sit in between this one and this one, but yet they're out of range for this one or this one. So that's kind of hard, yeah.
Yeah, so we've been working with Rockbridge to try to be able to see, can we get some volunteers over there? It has definitely been
So what is the tax levy?
124,000.
Pardon?
124,000. And if we wanted to serve border to border, I'd say we need closer to 200,000. Just because of the cost of the meals and staff member to be able to, we'd have to have a paid staff for that if we couldn't find, we just haven't been find volunteers.
The other thing we probably should say about that is it's a safety thing too. Because oftentimes people who deliver meals will find somebody is ill or fell and can't get up, that kind of thing.
Yeah, we actually initiate welfare checks, I would say at least once a week, sometimes 3 or 4 times a week. We actually had a driver that went to drop off a meal to somebody's house, him and his wife, and the person was actively having a stroke. The family had checked on her earlier that day, and then normally they would check on him later that day. But when our drivers went to take the meal, she was actively having a stroke. Because our drivers were there, they were able to initiate EMS, and our outcome was better than what it would have been. So, and there's been many times that people have been on the floor that we initiate those welfare checks. So that happens pretty frequently. So that helps reduce admissions to nursing homes and hospitals by us being able to be that safety. It's more than just a meal.
Sure. So your volunteer drivers, they're volunteers, correct? How do you recruit? So we do morning shows, we do newspaper, we do church bulletins, we do presentations, we have service groups. The churches have been really great. We've got local banks that adopt a route, we do that. You name it, we. Yeah. Any other questions?
Should probably say something about your relationship with legislators too, because that's kind of a strong one.
Yeah, so the ADRC does a lot of advocacy. It's one of our roles, is we are required to advocate. We can't lobby, but we do advocate. So we have very close relationships with Senator Kieski's office and Tony Kurtz. We meet with them very regularly to let them know what are we seeing for issues. The other thing that I do is, and the other counties don't do it as much because they're not part of Health and Human Services, but I see all of the costs related to our, if people have to go to Winnebago, for emergency detention, it's $2,200 a day. So I see that. I know the numbers. So I really push that really hard with our legislators that, not only is it ADRC services and funding that we need for our aging funding, but here's the impact of the state not helping to pay for that, because those are court ordered. It's not anything that Health and Human Services can control. When somebody is chaptered, that's illegal. That's a court initiated process, right? We're there to manage and maintain contact with a person, and follow through with them and get them into other programs. However, it's something that's mandated. It's nothing HHS can do about those. So I've had a lot of conversations with Tony Kurtz. He is actually the Joint Finance Chair for the Assembly. So we have lots of those conversations of how is that impacting? I mean, you've got a $1.5 basically $1 million allowance for these court mandated placements. The county has to pay it. We don't have a choice. And you have, what is the county's, total tax levy is 30 some million. And so when you put it into that context, having those conversations at that level, they're kind of like, oh, so then it sparks more conversations. So we do lots and lots of advocacy work. Larry actually's gone to aging advocacy days with us, and we just keep pounding him with information. I can't ask him for anything, but I can at least give him the information. So we do a lot of that in all of our programs. Anything else, Larry? Okay.
Thank you.
Yeah, sorry. Yeah. Sorry to take so much time.
Economic support.
Hello.
Hello.
Brianna, I've been in the economic support unit for 25 years and became manager in 21. What our unit does, economic support specialists, they determine eligibility for public assistance benefits. And those benefits are food share, Badger Care, Medicaid for elderly, blind, and disabled individuals. We also figure eligibility for caretaker supplement, which is a benefit for parents who are on SSI. And then we also figure eligibility for Wisconsin Shares Child Care Subsidy, which helps parents pay for daycare. Our unit is also responsible for certifying childcare providers in Richland County. Let's see. So we do this in a consortium of 8 counties. The counties are Adams, Columbia, Dane, Dodge, Juneau, Richland, Sauk, and Sheboygan. So the work is done using a call center model. So our staff can speak to anyone in those 8 counties that call. In 2025, our, staff answered almost 23,000 calls. And our goal for that year was 7.75% of all calls we were to answer, and we answered 9.06%, so that was a highlight. In addition to answering calls, they also have to maintain a caseload. So the caseloads are anywhere from, for family staff, it's 630 cases per staff person, and for elderly, blind, and disabled, it's 850. And those, again, are cases throughout the whole 8 counties.
So there are tasks that go along with doing the casework. And so I report on those every month, but for the whole year of 2025, Richland did 9.9% of those, be just over 95,000 tasks, which again, that's not like one for applications, that there are multiple tasks in each application and renewal. So one of the highlights was the application for, they have 30 days to process an application, and the state timeliness benchmark is 95%. The consortium had a timeliness rate of 98.13%, and we exceeded that and did 99.14% in our application. So that's pretty proud of that. And then also, the workers take 2 to 3 days a month where they are in office. If they're remote workers, they come to the office, and they are the contact person for other agency staff, county staff, and the community. So for walk-ins, someone who calls the agency instead of calling the consortium, they're there to handle that. So in 2025, we had 1,171 contacts. Let's see, so I think this might answer a question someone had about how many Richland County residents are receiving assistance. About 24.6% per quarter. And that again doesn't mean I'm sure there's a lot more. It's just, it's voluntary. They come to us, and if they don't want the benefits, we're not going to.
So that compares with other counties. That median.
I don't know that. I can look that up. That wouldn't be too difficult. I can reach out to the other consortia counties and.
That's not my number. 40%.
Quarter of the population on some sort of public assistance benefit.
In 2025 for food share, the number of Richland County residents receiving that benefit, 1,198, I'm sorry, not people, but cases. So there are gonna be many people on a case, but that was 1,198 cases. And interestingly, the food share program brought in over $4 million to Richland County's economy. Pretty good. Let's see. And for medical assistance or Medicaid, that includes Badger Care and elderly, blind, disabled medical assistance. The most recent numbers we have are from 2024. And 5,019 individual recipients received medical assistance of some kind for 45 million. 45 million.
About a third of the county.
Pardon?
It's about a third of the county.
Yeah. But it's, it's a good thing though. People are getting the help they need. It shows there's a big need. The caretaker supplement again is for parents who are on SSI. It gives them extra cash benefit on their state SSI check. And there were 11 children, so they get paid per child. And so there were 11 children and 21,000 in assistance.
What are those funds intended to support?
Just, it's like an SSI, it just gets added to their SSI payments, so daily living, rent, taking care of their kids.
You guys work with child support?
Yes. Yes, yeah. Let's see. Wisconsin shares childcare subsidy. If we had more regulated providers, this would be hopefully a lot higher, but we don't have very many regulated providers in Richland County. So it's 40 families, which is better than it has been in the last couple of years. And then the number of children served is 69, and then $268,000 in benefits was paid to providers to care for.
What's your opinion on why we have few licensed childcare providers here?
It's not easy to, you have to keep a lot of paperwork, you have to keep a lot of,
Regulations.
right, there's a lot of, yes, a lot of,
parents.
right. And yeah, I'll stop. Yes, a lot of regulations. For the program integrity and fraud investigations, we subcontract with Dane County. And because they have full-time staff that do that. And so again, why did you have the pros do it if you can? And we had, in 2025, 37 fraud overpayment referrals were created on Richland County residents. And that was overpayment amounts of $20,000. And daycare certifications, we do that also. My lead worker and I are the ones that handle that. There are none, and we've had none for, well, since I started this position. But fingers crossed, we're going out week to do a home visit to certify. So I can hopefully next year put one on the report. And that's all I have. Does anybody have any questions?
Oh, I do.
Yes.
As far as compliance checks, that type of thing, the bigger daycares like Sunshine and Giggles, do you guys do those?
They're licensed. The state does the licensing.
Yeah.
Yeah, I've received, people are welcome to, if they have concerns, they're welcome to let me know. And then what I would do then is forward that information onto the state, and then they'll investigate.
Thank you.
Thank you, Brad.
Brittany, Child and Human Services. Once a year, hang in there.
It's a long one, it's a longer one than.
It is, but,
Because the
um,
new members are asking great questions.
well, and also too, there was an ask by the county administrator to do, board education. So this is an opportunity for us to educate you as a committee. It's recorded, so now we can get passed along to the other board members so that, they can become more educated about our program. So that's kind of part of this too, why it's a little bit longer.
Super.
So again, I'm Brittany, the Child and Youth Services Manager. This unit is made up of the unit manager, a lead social worker, 4 social workers who act as case managers, a family preservation worker who does a lot of our prevention work with families or supervised visits with parents and kids if needed. Then we have a youth aid worker who does a lot of our mentoring with at-risk youth out in the community, so. One of our programs in the unit is probably the main one that people are familiar with. It's Child Protective Services. So investigating abuse or neglect reports that come in. And in 2025, we received a total of 305 CPS reports, and 58 of those were screened in for an initial assessment, which is a 60-day investigation to determine if that abuse or neglect occurred to the child or children. Another program in our unit would be offering child welfare services or voluntary services. So reports that don't rise to the level per our state statutes or standards for an investigation, we have the ability to outreach and offer some prevention services for those at-risk families. And if at any time that we can do that, we do that just to get in there and help families out. So in 2025, we received 84 of those types of reports, and 76 of them were screened in to offer services. So I'm assuming the other ones, the 8 of them that were screened out were likely because maybe the case, the family was already open with us, but we received a subsequent report on them, so we would screen that one out because they're already working with us. Another area is youth justice, or juvenile justice, it used to be called. So this is where youth who are 10 to 17 years old, they commit a criminal offense. So, in the adult world, you'd go to your criminal court. Those types of charges get referred by law enforcement to us, and then we process them at HHS. So in 2025, there were 31 youth justice referrals, and 3 of them were formally petitioned. 11 were counsel closed, and at the end of the year, we had 17 that still didn't have a decision. We have timelines where we, I'm assuming at the end of 2025, those timelines hadn't been met yet for us to make our decision, so that's why those were still pending at the end of the year. Another area in our unit, which isn't mandated, we just offer this, is our youth empowerment services, so our YES program. That is where our youth aid worker, that's kind of his baby. He runs that, he came up with that. And it really is a program that works with our youth who are on our delinquency borders, or youth who are even at risk. Or youth who just want or need positive social engagement. So it really helps with self-esteem, citizenship, cooperation. They work on life skills together, get out in the community and do things. So every summer our youth aid worker runs this YES program 2 days a week throughout the entire summer. So in 2025, we had 8 youth enrolled in that program, and 6 of them came consistently, which was good. So, and at the end of the summer, we do a fundraiser for the parking lot of HHS. We do a car wash and Brad's hot dog sale, and the proceeds to that goes back to somewhere in the community. We've done, to the K-9 unit, we've done to the Humane Society. I think this year they're looking at doing it to Passages or Ada James, giving back the profits to them. So, and then foster care, kinship, those are mandated by the state that we have those programs. Richland County can license level 1 and 2 foster homes. We currently do not have any foster homes, but we just had a worker that left, and then our worker in the unit took over this program, and she's wonderful with outreach. So we're hopeful that she just has the two homes interested, and we're hopeful that she can get this program up and running for Richland County again. So. That's pretty much it. I mean, our unit has been working really hard to achieve permanency for children or youth, which is the state really mandates us to do that and push for that as best as we can. And I think in the last 2 years or so, we've really strived to do that, or at least keep them in their home, as Stephanie was saying earlier, the best way, the safest way that we can. Sometimes that's not doable, but we really try for that. And that being said, sometimes kids don't return home, but they do achieve permanency, so they can have a more stable life. So in 2025, we did file for 10 guardianships, 10 kids were able to achieve permanency by going to guardianship with a family member or friends. And then we have our ongoing kinship and non-subsidized guardianships, which were 18 of those, and 3 subsidized guardianships, so.
You know, this is really important work, I guess, seeing the parallels between this and the behavioral unit. Just wondering why structurally two separate entities.
That's kind of been a moving thing. It's been, a moving piece. I think at one point in time, like the child CLTS version 3 was in Child and Protective Services. And so then that kind of works that way. At one point in time, I think there was more of a behavioral health piece. I'm not really sure the history why they got split. The abuse and neglect part of it, that kind of has to stay separate. It's moved around over the years. I don't know the history behind how they got separated like that.
I mean, the parallels are so clear.
You're talking about,
It's just generational difference.
Is it that separated out in other counties? I wonder.
Oh, wow.
I think every county is set up a little bit different depending. Are you talking more for like the CLTS Birth to 3 program? Is that what you're saying?
Well, the Child Protective Services, how different is that than the Adult Protective Services?
Oh, child and adult?
Oh, that's completely different.
Yeah.
That's statute.
The statutes have that. They're separate programs statutorily.
Completely different trainings.
Totally different requirements as far as 24/7 on call.
Right.
So completely different that way.
I'm just,
Yeah.
for me, it's a structural question.
Yeah.
What's right and what's wrong.
Yeah.
Most of the reasoning why things are set up the way they are in HHS is it's statute driven. So.
Yeah.
The only thing is, it's like you said, birth to 3 and CLTS, that's moved between the two over the years, but everything else is statutory.
That's.
And keeping them separated makes it easier to keep track. Probably financially and.
The funds for the programs come from different avenues. Yeah.
And then from a manager's perspective too, right?
Yeah. Different types of staff required.
Correct,
Staff
requirements,
knowledge,
credential
too.
requirements, all those things are a little bit different. But good, I mean. Yeah, I do know that CLTS Birth to 3 used to be in CPS at one time, I think probably because of those military services.
Yeah, I'll speak to that. We transitioned to mental health because we were working more closely with mental health services. And so like our staff requirements were more aligned with the mental health staff requirements for supervision, oversight, that type of stuff. So it aligned better with being within the mental health unit versus the Child Protective Services unit.
But I mean, there are other counties that have those services within their Child Protective Services unit.
But I don't know of any county that has CPS, APS.
No.
Any other questions? Thank you so much.
Thank you.
Thanks for bearing with.
No,
And for. I'm so sorry.
Brittany's like, I should have asked to move agenda items around.
No, it's actually really interesting. It's nice to hear.
All right, Brittany, you're on.
Okay, so just as usual, you get your administrator report. We're currently in our window for our annual survey. So we have a lot of education that is happening with staff for preparation. We're just gonna go over previous citations that we've received and just do education based off of that. So we're currently working on that. We did have a self-report so far this month. So for those of you that don't know, we kind of tattle on ourselves in anticipation, of a complaint or whatnot. So if something can cause or can be reasonably what they like to use is reasonable suspicion of like an adverse event occurring. We're supposed to say, hey, this is what happened. We create a plan of correction. Pretty much on our end, we do an investigation, we do education, we do audits, we do all these things. Because obviously we're humans taking care of humans. We have to allow for human error, but we have to make sure we don't allow for those to continue. And we try to address things pretty quickly. So we did do that this month. And it was due to a medication error that resulted in an adverse event. So that has been reported, and we have sent everything off inappropriate. For staffing updates, we're still, in need of nurses. CNAs, we are kind of dwindling down as we are sending our own, staff RAs. We send them off to school to become CNAs, so we kind of grow our own in that aspect, but we're still struggling with that licensed personnel. So retention right now, obviously we want staff to be heard and know that they're supported. We actually just started a culture committee. And that's just allowing multiple staff from different departments to kind of lead how they want the environment to be. Just being able to address any issues, concerns they have. So we have our first meeting on Wednesday, and that's going to be kind of like I said, with all the departments, just kind of being able to, get the support and, try to help initiate more positivity and things within the building.
I'm sorry, who's leading that group?
The staff. So we'll be present, but the staff are going to lead it. So we have all the paperwork, we've created paperwork for them, just to kind of base it off of. It also kind of helps with our safety committee as well, just to any hazards that are happening in the building that we should know about. So technically the staff will be leading it, we'll just be support.
Is it a structured meeting or come and share your?
So it's going to consist of so many staff members. So it just kind of allows for, let's say CNAs, we have a CNA, they come to that CNA and say, hey, these are the problems that we're seeing, or like, hey, we're having issues with such and such department. So it's just a way for them to kind of bring that information to us so we can better know what's happening. And maybe it's just a more safer, feel for a conversation to happen.
The reason I'm asking questions is I have experience in leading those groups of that nature in the past, and it can be kind of a fine line between it being a complaint session versus a constructive, outcome-based discussion. So some structure is helpful.
I'd like to pick your brain if I can.
Okay.
Yeah. Maintenance. So obviously, you guys are aware, we secured our roofing. We're picking out the roofing stuff. We also got approved for the DNR for our reservoir to be redone. So for DHS, our requirements is every 2 years with a water reservoir. We're also supposed to drain and paint the inside. So when we have the repairs done with the rebar and all the cosmetic issues that could cause problems in the future, that's all being fixed, and then that painting is going to occur at the same time, so that obviously concrete's not peeling or whatnot. So that is a requirement for our life safety of our DHS portion. So that will be done. That was something that we talked about last year when we had our water issue, has since resolved. But yes, so that is going to happen. We're still having issues with our call lights. We had them come out and try to troubleshoot and do all that. Sounds like we have to, the system is 10 years old. So it sounds like we do need to upgrade one of our port thingies. So I did get the quote on that. I'm going to talk to Chad. So we have a linen company currently called Vestas, and you guys will see it on the AP. We actually are transitioning to city. It is a 30% cost saving, but the other part is our residents are getting personal. So like if somebody accidentally puts, because we do personal laundry at the building on each of the wings, if we accidentally put somebody's like a blanket or a comforter or a piece of clothing in with our linens, because they do the washcloths, they do bedding, we don't get their items back. So they don't send them back to the building. So sentimental items can be missing, or we have to replace those items. So this new company, City, that's coming out, they're going to start with us on July 14th. They will be getting our personals back. That is kind of their huge motto, is that they'll, we'll get our personals. So it comes back in a mesh bag, washed, residents keep their items. So we're spending money trying to replace the items that are missing. So that'll be a nice cost savings in general there. So we're super excited about the new company coming in. We had we do our normal fire drills every month, that we're required to do. We've done a lot of, elopement drill. We've done several of those with the staff. So those are good. Food satisfaction has increased significantly. I just looked at all the resident council minutes and it's been a significant, better satisfaction, very rare complaints anymore. So we're still working on our matrix issues, just trying to really go paperless. We're just struggling. I emailed them. It's kind of a contact issue and response from them. So working through that, and hopefully we'll have an answer there for our EMR. And then, like I said, resident council highlights, and we'll continue to try to make these better. Questions on that?
When's the fishing trip?
June. Actually, I think that's coming out next week. Next week. And the gentleman that is doing it actually redid the whole outside and is really excited to see what the residents think. And he's got like it all decorated. It's shading and the lawn looks really great. So he's really excited to see the residents.
You said you had a busload of people.
Yeah, we do that, a couple busloads of people. So we take them out and they go fishing and yeah. So they're really excited. That's like one of their highlights. We have the chicken barbecue coming up as well. The 28th of June. It's on a Sunday, so mark your calendars for that. Any other questions?
And a donkey visit on the 26th.
Yes. We are busy. We love it.
Come on, see him. Beat him. Give him a hug. Miss Purdy would love that.
And then the next couple slides is going to be May and April. So I'm going to kind of just go through because you're going to see a high checks. And those are just requirements. So you're going to see obviously our medical staffing. So I will break that down in the month. And the way we're doing our invoices and paying our checks is completely different than what we've been doing. So instead of seeing just a big batch one time a month, we're actually doing it over a weekly period since we've changed that. So in the month of April, agency, we spent $76,000 on. And then so far from the 31st of May, we spent over $37,000. So we're seeing that number decrease, especially as we hit the summer months with our on-call staff coming back. You'll see a $13,000 Wisconsin Department of Health. That is our bed tax. So we are required to pay that monthly to license our beds. The Inalon, which is the 407, that's our claim submission. That's who we submit our claims through. Let's see here. McKesson is our medical supply, but this one, our foundation. So we purchase items through our account and then the foundation reimbursed us. So the McKesson medical supply is being reimbursed by the foundation. So that's kind of a wash. We didn't actually pay for that. Richland Hospital. So anybody that's on a Medicare Part A, we are required to pay their claims because it's an all-inclusive stay. So if they have labs or they have to go up for radiology or anything, we're required to reimburse the hospital because they are Med A. Wisconsin Department of Justice, the 105 is the background checks. The Aegis Therapies, that is our therapy department. So those are the ones that provide the OT, speech, and PT to our residents. Let's see here. Health Direct, that's our pharmacy. So that's who we get our medications from. Some of our residents do choose to use a different pharmacy. So you'll see that on there. It's a much lower, it's like 200 on here. Oak Medical is our medical director. So that is a monthly. You'll see that every month on him. Let's see here, Mobile X, that's our mobile imaging. So X-ray, ultrasounds, things like that come into the building. The LV labs and water, that's our water testing, so we're required to do a monthly water test to ensure it's safe for our residents. We are required by the state of Wisconsin to have a professional pest control, so that's the organ on there. Southwest Cap, town taxi, and then the ADRC is our rides to appointments. Performance Food is our food provider, and then you'll see a bunch of utilities, water, waste, things like that.
What is the Plain Valley H&R resident?
So our residents in the state of Wisconsin are required to have a trust. So it's money where they can put, so like Medicaid patients who get $55 a month, they have a place to put it so they can withdraw it for their personal items. That's what it is. We have to pay for that. So that's just that transfer over.
So the $1,100 was to do what?
That's our residents' money. So that's transferring it into their account. So the money comes in electronically to us and then we have to transfer it to their account.
I understand. Thank you.
Yep.
What is Grapetree medical staffing?
That's staffing. That's our nursing staff, CNAs.
Contracting.
That's our contracted. Yep, we're still contracting. It's mainly our nurses. So CNAs and things are not as bad. Maybe here and there, like if we have a lot of FMLA happening too. But yes, our nursing staff is significant when it comes to contracted.
So when you contract, is it someone that's in the area and they're coming from outside the area?
Sometimes they're outside the area. Majority of them do come from outside. So like Grapetree and Emergis, you'll see on here, those are kind of like ones that we contract for 12 weeks, 6 to 12 weeks, depending on our needs. So we can train them, do all that. The clipboard is kind of like, we've been very fortunate enough to have repeating staff that pick up, but it's usually like they can pick up a shift or they can pick up a group of shifts, but it's not like we have them for 8 weeks, we post it and then whoever picks it up. But we're very picky and we utilize the same people over and over again because they're familiar with our policies.
So the people who are coming for 6 or 12 weeks at a time, what kind of housing do they find for that time period? Is it easy to find housing or difficult?
A lot of them use them like places here in town, so like an Airbnb, but usually like we don't see a lot of out of state. So they're usually Madison or something like that. We've had quite a few of them where they actually have family in the area where they can stay, where it's like 20, 30 minutes away. But yeah, usually it's like an Airbnb.
And that's at their own expense.
Correct. Because they get a housing stipend through their agency.
Any other questions for Brittany?
I was just gonna ask Brittany, a few months ago, I think it was Richland County was upset that they were paying all the taxes, for the back and forth with the EMS. Is that 15,000? Is that your part that you're paying that out?
Yep, so that's actually covering from January until whatever. Because we had agreed to do that at the beginning of the year when all that stuff kind of went down. So when there was that, all that talk about the EMS. So of course.
Has it just leveled off? I haven't heard anything about it.
I haven't heard anything. I said that we were comfortable because we are required to pay for Medicare A patients. So if they happen to have somebody that's on Medicare A, we are happy to pay for it, but it's kind of where we're at. But yeah, we have no problems paying for it.
Thank you for hanging out.
Is this when you said there would be more information on both revenue and expense?
I actually was able to pull up, so May's not done. Ours, kind of like how they talk.
First.
Yeah. Yeah. So I was able, while we were sitting here through theirs, I was able to pull up. So in April, our revenue was $885,990.96.
Thank you. Any other questions, comments? Here's none. Go. Item number 10, discussion and possible action. Resolution recognizing the retirement of an employee of the Health and Human Services Department.
Yeah, so, Richland County Health and Human Services has another retirement coming up. Actually, tomorrow is her last day. And we always, for certain, I should say, we always like to recognize our retirees. For the most part, I think there's a policy where they have to be like vested at least 5 years or something like that. So, I hesitate on always, but, yeah, so Deb Dittmer, one of our fiscal specialists, she's hanging up her hat at Health and Human Services and gonna do the retirement thing. Yeah, so she's had 8 years with us, so we'd like to recognize her for resolution at next county board, and it has to start with your approval. So,
Motion to approve.
Second.
thank you.
Any discussion? Hearing none. All those in favor, please say aye.
Aye.
All opposed, please say nay. Approved. Go on to county board.
Thank you.
You're welcome. Any correspondence? Any future agenda items? I just want to say one thing for future agenda items. I know, today was a extremely long meeting. But if we do this again, maybe we could, my suggestion, if we can think about it, let me know. If we do this again for the annual report, maybe that's all our should be about, is the annual report. If the administrator still wants the education. And I enjoy learning
Sure.
what each department does.
But have it separate.
Have it a separate meeting,
I
maybe
think-
that will be our meeting for that month unless there's pressing things that need to go in front of the board.
Suggestion for next year.
Suggestion for next year. Okay. Anybody else? I need a motion to adjourn.
I'll make that motion.
Okay, second?
Everybody's hand goes up.
Second.
All those in favor, please say yay. Yay. All those opposed? None. This meeting has adjourned. Thank you, everyone, for coming and hanging out.
Thank you.